Okay, good afternoon. Welcome, everybody. It is Tuesday, May 5th, and this is the Board of County Commissioners work session. We have in the room here myself, I'm chairing today, and Patty Clapper, our other commissioner, and we have our admin support, making sure we keep going and keep everybody moving efficiently. So thanks, everyone. And then from home, we have Commissioners Steve Child and George Newman and Greg Poshman, and our County Manager John Peacock joining us remotely as well. So today we are going to start with a proclamation celebrating National Composting Week. So I'm going to stand up and go ahead and read this proclamation to everyone. Okay, proclamation of the Board of County Commissioners of Pitkin County recognizing International Compost Awareness Week, which is May 3rd through 9th. Whereas the Composting Council Research and Education Foundation, along with Canada, Australia, the United Kingdom, and other countries, have declared the first full week of May to be the annual International Compost Awareness Week. Whereas composting is a way of returning organic resources to the soil and is a way of conserving water during extreme drought or flooding conditions, reducing water consumption and non-point pollution, and a proven method of decreasing the dependence on chemical fertilizers and decreasing erosion. Whereas composting is an effective form of waste reduction, reuse and recycling, and since organic materials make up approximately 30% of the material going into landfills, composting is becoming one of the primary methods communities use to reach waste diversion goals. Whereas materials such as yard trimmings, vegetable cuttings, biosolids, food scraps, manures, and hay shavings have all been composted and converted into a beneficial product known as compost. Whereas communities, through their local governments, highway departments, soil conservation service and extension offices, and public works professionals, can have significant impact on clean water, soil, climate change, and landfill diversion by using compost for public works projects. Whereas composting creates green jobs in Pitkin County and the Roaring Fork Valley and provides high-quality local materials for gardeners, farmers, and landscapers. Whereas this year's international theme, Soil Loves Compost, highlights the connection between compost use and soil health. Now therefore be it proclaimed that Pitkin County values healthy, living soil in gardens and wild spaces as part of a thriving natural and built environment. In a remote mountain location like Pitkin County, composting is an important way to keep nutrients local, enhance local food production, and reduce the carbon footprint of importing soil additives and food from far away. Okay. National Compost Week proclaimed.
Just want to say thank you, Kelly. Thank you for reading that. That was lovely.
Yeah, Liz, let's go ahead and bring you up on the screen and see if you have any comments as you are in charge of our compost programming out at the Solid Waste Center.
It is a great honor to be able to work out here on our composting program. And I would just add as a quick summary, we've been composting about 12,000 to 13,000 tons every year for the past few years. And we're very proud of our compost program and happy to be celebrating International Compost Week with composters across the world. So thank you for participating and letting it be known that the Pitkin County government supports composting.
Thank you so much, Liz. And we'll go ahead and just take a minute. You had asked that us commissioners go ahead and send in some visual demonstrations of how we compost at home. And so we collected some photos, and we'll just take a minute to put that up as a slideshow.
Great, thank you.
Okay.
I think that's Steve
that?
Child. That's Steve's. And the gardens that are coming up next are mine. They are total recycled products from the landfill. This topsoil, potting soil, and compost went in to make up all the soil in my 2 raised bed gardens.
Great.
And I'm going to send another picture in a month and show you what it really looks like when they get into full bloom.
And I'll just note the picture we showed with my kids was to demonstrate the different size receptacles we use, the smallest being the trash bin at our house, and then in the middle is our recycling bin, and then I'm sitting on our compost bin. And if anyone, Steve, would you like to jump in and explain your photos?
I'm not seeing what you are looking at
Okay.
on my screen. So one of them shows, I actually showed our food waste bucket that we keep under the sink. So all of our food waste goes into there, and then we take it out periodically to the compost pile. The other pile is the compost pile, and just today Devin turned the whole thing because we had all the rakings from the lawn and at the end of the winter, plus all our food scraps are in there, and then we'll add some cow manure into there also. So it's a pretty sizable pile. We've been composting for really decades because I used to compost, when we had a bunch of cattle, I would compost a lot of the manure, and we would have huge piles that we would build with the tractor, but now we have a more modest pile there in the yard.
Great, thanks, Steve. And I'll go check in with Greg and George. Any comments you'd like to offer?
I can't see the pictures, so I don't know if Pat got them. I sent some videos and I sent some photos. I've been working on, we have a similar sort of compost. We've got a bin under the sink, which we fill once or twice a day. It's amazing how much organic food waste we produce that we could divert to compost. So that was an eye-opener to see how much we actually produce, and it's a significant amount of our trash stream. I'm also doing a lot of brush mitigation. We're doing fire mitigation up here in Brush Creek. This whole hillside and this whole neighborhood is pretty much choked with scrub oak and sarvis and berry and chokecherry and all that. And so I'm trying to create a fire barrier around the house. And so we're grinding that up too. So it's going to be mixed with some of our compost as we put it down, and it helps suppress weeds too. So we're chipping a lot. We're going to be chipping a lot, as well as this brush cutting. But the compost goes to a bin down in our dumpster shed for the community, and that contributes to the stream at the landfill. And I think we're still a profit center. I'm so proud when we get to talk about how our compost operation actually makes money for the landfill, and it's a growing business. And I just love talking about that and hearing about it from Liz.
Mm-hmm.
Can
Thanks,
I ask,
Greg.
Liz, isn't there a program right now people can sign on to and they get a coupon for compost?
There's a couple things going on. So there was a Evergreen Zero Waste, which is one of the main compost haulers in the valley. They were just doing their own sort of awareness program for their customers. And they actually purchased a lot of our bagged compost and resold it to their customers. And then as part of that, people who couldn't get their bag right away were getting a coupon for compost. But yeah, that was the only coupons that we gave away this year.
I thought there was something you signed on to with the landfill. I thought Kathy Hall brought it to our attention.
Oh, there was an idea at one point to start a program where people would bring in their compost and then they could fill their compost bucket up and take it away. That was an idea about 2 or 3 years ago, I believe, but I don't think it ever actually happened. There wasn't enough interest.
Well, I'll see if I can follow up on it. Either she brought it to our attention, or maybe I had a dream about it and we should bring it to our attention. I don't remember exactly, but I'll look into it. Thanks, Liz. You do a great job out there. We really appreciate it.
And George, I want to go ahead and check in with you if you have anything to comment.
Thanks, Kelly. Just a question for Liz again. I know you have a new pledge program at the landfill, and by pledging to reduce, reuse, and recycle, you were able to get some potting soil. Is that available at this point, or what's the status?
Yes, thank you for bringing that up, George. So that was through our Earth Day program that we did in partnership with ACES. People could go online and make that pledge. People could go online and make that pledge, and I'm not sure if all those people have picked up their compost yet. I bet most of them have not.
It wasn't compost, it was potting soil, wasn't it?
Yes, but if they wanted to take a bag of compost, they could take a bag of compost or potting soil. They're both in 25-pound bags, and they're both $3.75 normally.
Great, thank you.
Mm-hmm.
Liz, that's the program I was talking about.
Okay.
Yeah, so thank you.
All right, Liz, thank you so much. And, for all the work you do out there. Thanks to our haulers for running the program from residential curbside. Thanks to individuals who drive their compost up to the landfill. And, yeah, enjoy the week.
Thanks, Liz.
Thank you.
Okay, moving on to our agenda is our Box It In strategy regarding COVID-19, and our County Manager, John Peacock, is going to lead us in this discussion.
Thank you, Kelly. And Andrew, am I able to share my, can you click so I can share my screen?
Just 1 second, John, we'll get you.
Okay. Bear with us for a moment while we deal with our new virtual world.
Go ahead and try it now.
Okay.
So you'll click the green share button and then select a window. Oh, here we go.
Of course, now my presentation will not come up. There we go. Okay, are you seeing my screen?
Yep, looks great, John.
Okay, excellent. So we scheduled.
We're not seeing it, John.
I can see it.
Oh, okay. You haven't started the slideshow yet. It's just the title page.
Yeah, it should just be the title. Did that switch for you there, George?
Yeah, thanks.
Okay. So previous meetings, in our most recent Board of Health meeting, we've talked about the building the box really for boxing in the coronavirus. And so today we've set aside time to give you as the Board of Commissioners an update on where we stand in that strategy now, looking at resource gaps moving forward. And then following the Board of Health meeting, we have a more detailed draft of the reopening roadmap, and it aligns to the state order and except in some specific areas. And we want to spend a little bit of time updating the board and getting your feedback on those areas, and then just have some time for board discussion. And so I know we've gone through this before, but just in case there is public watching, the COVID-19 pandemic is the most serious outbreak that we've faced since the 1918 flu pandemic. The virus was first detected in the United States on January 21st of this year. And since that time, it's already killed over 65,000 people, including 766 in Colorado and 2 in Pickens County. And it's different than previous pandemics like the H1N1 pandemic that we experienced before, because as a flu, we had better infrastructure set up initially for testing. And also we were fairly quick to a vaccine. As we've experienced since the beginning of this crisis nationally, there's been a supply problem with accurate and timely COVID-19 testing. That's been getting better, which is good. And medically, there remains no treatments or vaccines. And so we really are medically defenseless in terms of eliminating the virus right now. Best estimates out there, or best case scenarios, is that effective medical interventions will be available in 12 to 18 months. And so until that is the case, until there's an effective medical therapy, we really have two strategies available to us. The first is really the blunt instrument of public health orders. And those public health orders are designed to slow or suppress the spread of the virus by through requiring physical distancing and also basically just reduced activities and opportunities for people to interact. In the absence of testing capacity and what we'll be talking about a lot today, contact tracing capacity to deal with the scope and the rapid spread of COVID-19, the public health orders were our main tool that we used, and they have successfully ratcheted activities down into a suppression strategy. The second strategy is, instead of dealing with it on a population-wide basis, is to meet the virus where it is and get it isolated. And that's the boxing the virus in and allowing us to resume more normal levels of activity and reduce the really significant social and economic disruptions that the broad-based public health orders cause. And there's really four essential actions around that box it in strategy. The first is you have to have widely available testing for all symptomatic individuals, and you need to have a quick turnaround on that testing so that you can quickly identify those who are infected, and you can get them into isolation so that they do not spread the virus to more people. You also need to then go through a process called, this is the contact tracing part, where you find everyone who's had contact with that infected person, because they are now at risk of also being infected. Those individuals need to be quarantined for 14 days, and obviously if they become symptomatic, they go into the testing and the loop starts. Again, this is really the strategy that you've been hearing a lot about, that South Korea was able to employ very quickly, and other countries who have had success in really mitigating the impacts of the virus. As a nation, as a state, and locally, we were not prepared for the scale or scope of this pandemic to employ this strategy. And so we've been using the time that the public health orders have been in place to build that capacity. On the testing front, for the past week, we have had wide-scale PCR testing available at Aspen Valley Hospital for all Pickens County residents with symptoms. Test results are coming back in 48 to 72 hours. We're still looking at options right now to continue to shorten that timeline. But when we came into the pandemic and testing capacity was really limited, those test results were taking anywhere from 5 to 10 days to return. In terms of our symptom tracker, as of the end of April, we had 445 responses. And we've acquired additional personal protective equipment capacity to cover the hospital for potential surge, which is one of the reasons that testing was really limited to those who had the most severe symptoms initially. We're still actively pursuing additional testing supplies from the state, and we're also continuing to constantly analyze new testing technologies that may improve. On contact tracing, we've used the time to really build what I'd say is a bridge or a temporary solution. We had one half of a FTE that is dedicated to epidemiology and contact tracing, and that's good for limited spread infections that we use this process for, like TB, or when we had the Ebola scare a few years ago. But the scope and scale of people affected or potentially affected by COVID-19, as we'll talk about in a few minutes, this is really not an adequate level of resource. So in March and coming in April, we've trained 11 contact tracers, employees from the city of Aspen and Pickens County, who are prepared to step in and play that role. And I'll come back to why that number is so important for what we're trying to accomplish in a minute. We are still looking to increase our staffing for surveillance and monitoring active cases of COVID-19. And so, and along with that is how do we build a sustainable infrastructure for the next 12 to 18 months? Because as more normal levels of activity are reintroduced, these employees are going to need to go back to their regular jobs. And then we need to keep developing just this community dialogue about why it's so important for people to share who they may have had contacts with if they do test positive, and to really support our contact tracing activities.
Hey, John.
In terms of isolation.
Can I jump in for a sec? I just want, I know you guys are moving a million miles a minute, and, you know, we received the presentation last night or the memo last night, and the public would have received it this morning. But I do just want to make sure we're going to have enough time to discuss all of the big topics. So I think our board has tuned into a lot of the Board of Health meetings. And, you know, so I just want to recognize time, because we do have a full agenda, and I want to get to our time together to talk. Okay.
Well, I can go through this a little more quickly. I wasn't sure if everyone had tuned in. And then quarantine is the other part of that box. In the memo that you received, then one of the challenges in determining what capacity you need to have for both testing and for contact tracing is understanding what population you're actually serving. In Pickens County, we have a census population of just under 18,000, but we know that our population has other significant components to it, including part-time residents, our visitors, and commuters. And if you look at low versus high season, our population tends to vary between 33,000 and 53,000, with an annual average population of 43,000. If you take out the commuters, our population ranges from 27,000, which is probably pretty close to where we are now, maybe a little less, to 44,000, with a average of 36,000. And the reason we look at these numbers is we are responsible for the cases that are in Pickens County. So these are kind of the population numbers that we'd be looking at. So in terms of testing, daily testing capacity, what you're looking at for a standard from, and this is from Harvard's National Institute of Health, they have recommended that communities target a daily testing capacity of 150 tests per 100,000 population. And so you break down, if you're trying to serve various components of the population, that breaks down to being able to do somewhere between 50 or 60 tests a day, and you can see the number of tests by the different components. Of course, where we stand right now, you don't have overnight accommodations, you don't have quite as many commuters coming in. So you're going to be well below this 39,000. This 39,000 is 90% of our average daily population. That's what we've targeted our contact tracing and testing capacity to. Similarly, for contact tracers, the National Association of Local Public Health Officials has done research and issued recommendations. Those were included in the Johns Hopkins piece, Kelly, that was in the attached information of 30 contact tracers per 100,000. You can see how that breaks down.
George, do you have a question you'd like to ask of John?
I do. Thanks, Kelly. John, back to where you're looking at the population by seasons and trying to figure out the numbers to contact for tracers. My question is, if we're trying to contact people and find out if they where they what am I trying to say? Where they've trying to trace it back to other people they may have come in contact with. You were using numbers that are somewhat elevated because of normal tourism folks coming in. How are we going to be able to trace someone that's coming in from out of town? I don't understand that.
So, George, it would be if they came in, became symptomatic, and tested positive for COVID-19, then we would get them in isolation. So they're not out in the community with spread.
No, I understand that, but part of the job of those people who are going to be contacting is then to follow up and try to trace where they may have, other people may have been in contact with the same person, correct?
Yeah, so are you concerned about how we would contact trace folks where they came from?
Right, because I think the numbers we're using is elevated with the premise that we're going to be contacting and tracing those people like we would do with our local population.
Well, I think the Australians are a good example, George, of exactly what you're talking about, where we had 13 individuals and a cluster of visitors that did not live here. And then through contact tracing had, contact with 56 other people. And so the real issue, George, is to identify the people that they've had contact with here. The population is based on us assuming that we're trying to get back to some more normal levels of economic activity. At 39,000, you're still way below this peak of 53,000, right? So I don't think it is necessarily inflated, because if you have guests here and somebody becomes symptomatic and tests positive, we're going to have to do contact tracing for everyone that they had contact with while they were here.
All right, thanks for the clarification.
Yeah.
Patty has a question here.
John, I mean, help me out with this, but you're saying that if we test 39,000 people, we're going to have 12 contact tracers. aren't we assuming then that all 39,000 people are going to test positive? I mean, are you giving us the worst popular case scenario?
No, that would be a lot more people, Patty, to contact trace for 39,000. So this assumes that roughly you have a 7 to 8% positive test.
So what have we had so far? We had 1 out of 50 a week ago, right? Yeah.
Well, we've got 51 positives.
But last week we tested 50 people at the hospital. Am I wrong on that?
Oh yeah, our numbers are down, but the assumption is, Patty, that as you introduce more activity and people come in, you're going to hit a higher rate of infection. And what you're seeing in countries that have done a lot of testing is around 7 to 8% of those tests are coming back positive. And so that's more the assumption.
Okay, well, you didn't give that information in this graph. So my question is, though, yeah, we're going to see a spike. We know that. We know when you reintroduce construction or retail and more people are coming and going, moving through the valley. Yeah, I think we all accept we're going to see some level of spike. But I just have a concern with hiring up, to the maximum worst case scenario possibility. I know you've given the analogy, well, you want to have all your firemen in the fire station just in case you have a fire, which I totally understand, but I don't think we have the luxury of doing that right now in this environment, economically or socially or emotionally or physically and health-wise. I think we need to be kind of looking at a level that is protective, but not going so far in one direction that we are taking our resources and focusing all in one direction without looking at all the other issues that the Board of County Commissioners has to look at.
Well, I'll take a little bit deeper dive for you guys, and I totally understand where you're coming from, because obviously we've had a huge economic shock that's going to be reflected in our revenues also. And jump ahead in the interest of time. And Patty, this is probably getting to some of your concerns now. That the real challenge is you have high and low seasons, and so you have a population that will vary between 27,000 and presumably 39,000 with continued social distancing requirements as long as COVID-19 is with us. And so it's how do you design a staffing model that can flex so that you're not having too much capacity during the high seasons, but you have enough capacity, too much capacity during the low seasons, but enough capacity during the high seasons that you can ensure a really robust contact tracing infrastructure. So using that 30 contact tracers per 100,000 in population, that would lead to the need for 6 contact tracers and 2 contact trace supervisors to serve that base population of around 27,000. You'll need to add another 4 as population surges, and so this pro forma basically shows the need for part-time, basically hours of contact tracers to fill in that surge capacity. In addition, we'll have a need for a public health subject matter expert, really to stay on top of questions, concerns, and the broader epidemiological questions associated with contact tracing. The second half of this then really has to do with the consumer protection side, because throughout until there is a successful medical intervention, there is going to be the need for amended public health orders. There's going to be the need for ongoing education by different industry, and there's going to be the need for really inspection. I'd almost view this like a food inspection program. So that would be another public health subject matter expert. We'd estimate the need for 2 consumer protection specialists, and then admin assistant data managers to support both functions. And so that really brings you to capacity, really 14 in the low season, flexing up to 18. And it does, Patty, to your point, have significant costs associated with it. 12 months of this staffing model is just under $1.3 million. 18 months is just under $1.9 million. And if you broke it down by year and appropriation, it'd be $639,000 in 2020 and just under $1.3 million in 2021. And I'll stop there for a second because I just went through a lot of data.
Yeah, John, I just want to check in. This seems like a good point to discuss this portion of the presentation as opposed to waiting until we get through the phasing conversation.
Yep.
Okay, so I want to check in with the board on questions on the contact tracing staffing model and what you've heard so far. George, do you have a question?
I do, thank you. 2 things. John, the study that we're using, 30 tracers needed for every 100,000 in population. I wonder if they're looking at urban, highly dense areas, and that may skew it a little bit in terms of our community.
You know, George, the board has representatives on it from rural counties. In fact, Karen is a board member on that national association. And it seems to be kind of a middle of the ground recommendation. Tom Frieden, who's former CDC director, pointed to countries that are more urban, like what China did in Wuhan. They had 1 contact tracer for every 1,000 in population, which is a higher ratio in those urban areas. In some of the more rural countries, they've had less. I think the recommendation generally is for in urban areas during normal times, 15 contact tracers per 100,000 population. So this number actually seemed to be vetted between different extremes. You know, if you're going with you know, there are other models that would suggest that 12 could be 18.
Okay, and then one other question, because as you talk further on in the presentation, when you talk about the phasing, I'm assuming that the contact tracers, the number of people that we need, perhaps could be phased in depending on how we're seeing our community being responding. I'm just curious, are we able to utilize volunteers to aid in this process and cut down the paid staff?
You know, yes, as long as the volunteer capacity is reliable and immediately available. And so there are real challenges, obviously, with that. And so, but yes, some communities are using volunteers. We need to have the infrastructure, though, to be able to train and oversee. And so quality control becomes more challenging when you're doing that. And if you want to really reopen significant portions of our economy, we have got to do this contact tracing well, or we'll be ratcheting back down. So that'd be the challenge with volunteers.
Yeah, I think it's something we should be looking at. Even if it's, if we could find 2, 3, or 4 who are committed. I mean, you used the example with the fire department. Well, the fire departments are volunteers, and they're not all at the station. They're all over the county, but when they're needed, they get called in.
Mm-hmm.
Yeah, and I think that's what's good about this cadre of really city and county employees that we have trained to do contact tracing is obviously if we have a major outbreak, we can draw for surge capacity on those resources too.
All right, thank you.
Steve, go ahead with your questions.
Okay, thank you. John, another thing that I would think of as a point of contact between our employees and people visiting here would be a place like the airport, where people are getting off a plane. They might be symptomatic, they might be feeling crummy, they might have a fever. If we could allocate some sort of resources to that, maybe it would be people already working at the airport to kind of screen the people getting off the planes. And as we open up, you know, when we get restaurants and some lodging open, there will be people coming here just because it's a nice place to spend the summer. Even if we don't have the music and the different big events, there will be people coming here. Some of them probably will be bringing the virus with them, maybe unknown to them, but how are we going to track those people? And do you see that as part of this contact tracing process?
Yeah, I mean, there are going to be some key areas where we're going to need to have, I think, a lot of cooperation to make sure we're quickly identifying symptomatic people and getting them isolated as quickly as possible, Steve. The airport right now is actually probably not a significant vector. There are not a lot of people coming in through the airport right now. But I think you're right. Looking forward, you know, our hope would be for our community to return, probably not to normal levels of activity. That's probably going to be a while, but more normal or sustainable levels of activity. And the airport is absolutely an area where we're going to need to figure out those processes. I know that is on our work plan. I won't tell you that we've got that nailed down yet. In terms of how we're going to do that, but that's certainly one of the major entry points where you can catch people, and then lodging, frankly, is another area where you can typically catch visitors who are symptomatic. So we'll need the cooperation of both of those industries.
Let me check in with Greg real quick. Greg, do you have questions on this topic or thoughts?
Yes, I was just looking. I'm thinking that I'm seeing a lot of information coming out about digital platforms that can possibly assist with data management, contact tracing, getting SMS and text message systems that give us real-time data on how the population is doing. And I know they've launched these in other states, and I'm just wondering. I'm expecting that will come with a price tag if we decide to pursue something like that, and I don't see a budget for that. So I'm just wondering if there are going to be some additional costs, regardless of how many people we hire. Are we also contemplating IT support and the cost associated with that, whatever form it comes in?
Yeah, so Greg, I think that's a good point. We have not we've anticipated kind of equipment costs and IT costs from that perspective. We have not necessarily incorporated purchase of an app. Our understanding is that the state of Colorado is working on a solution that may work for us. And actually, we're seeing a lot of we're hearing about a lot of options that may come at low cost. I know our BITS department has been keeping abreast of those. And as we have our teams built out to the degree that we can use technology to make this a more effective process and certainly a more efficient process, we will. I think it's like the early days of this, that there's a whole lot of options out there right now. We need a little time to vet them.
Right, and the making it more efficient and more effective may not necessarily make it less expensive either. We understand, and when you're in a rush, everything costs more.
Yeah.
But it's good to know Colorado's working on it's good to know BITS is working on that, because I anticipate that coming down the road.
Yeah, and I just note the contact tracing itself is still technology. I think can help quite a bit. It is still a pretty people-intensive activity, because there is, not just, there's a lot of conversations that need to happen and check-ins on a regular basis to ensure people are staying in isolation, to ensure people have the supports they need. People who get this virus are going to find themselves in very different circumstances, with very different needs in order to accomplish isolation and quarantine. And those are types of things that apps don't do. They're usually good at maybe helping you find what the contacts are. They're not good at the real work of managing it, which is really what keeps the virus from spreading. And that's what makes it such a people-intensive activity.
Right.
Okay, I'll go to Patty in the room.
Yeah,
Questions?
John, I really appreciate the fact that, that's what we depend on in the county government, because we have such great staff, is people stepping up to the plate. So you and I have talked about this briefly before and didn't quite see eye to eye on it, but I think we need to look internally. If we've already trained people within the city and county, and I know the thing has been, well, when we open up the city and county governments again, all those people are going to have to go back to work in their departments. But I think we need to look at that seriously. Just like we did in the 2009 recession, we had to go to each department and say, we need to make budget cuts because we have to absorb this huge economic impact. And I think we should really, like George was saying with volunteers, we should really look at utilizing staff members. And I know that maybe that week or that day or those couple days that week, that department might be short that person. But that's something, if that person got sick themselves or had a dentist appointment or had a family health issue that they had to leave the department, that department would figure out how to cope with that one staff member not sitting at a desk working, say, in finance or the clerk's office or whatever department in the county. And I think we really need to start think about utilizing our in-house staff to help us out in this situation, because to take a hit, and I know we can find the money somewhere, of $1.3 million to $1.9 million, it's going to be huge in light of the fact our economy, our revenues coming in are going to be drastically impacted. So we need to find a way, just like we would respond to a recession, how we're going to deal with this as a county, as our staff in-house, rather than just saying, well, we're just going to hire 13 people from outside and put them on the payroll. I'm not sure I can go there with that. I think there's some positions like an administrative clerk to help with data, and maybe one person who's a public health subject matter expert or whatever we're calling them. I think there's some wiggle room in there, but to just start out with, we need to gear up 14 to 18 new staff members without looking internally first is not the right way for us to go. I really have a concern about that, and where we're going to be in the future within the government itself, outside of the virus, where we're going to be economically and how we're going to get through it. And I think we really need to look at that. The other thing, too, is there was some information in here about, we're going to have, within 6 hours, we're going to have to get that person into isolation, and therefore we're going to have to jump on it. It's my understanding that everyone tested now puts themselves into isolation until the results of that testing is known. So therefore, they're already in that isolation self-quarantine loop. They only get out of it if they test negative, but anybody who tests positive they're already at home and isolated. And correct me if I'm wrong on that, but that's my understanding about the testing protocol. So I think there's a lot more we could be doing without having to just say, fund these multiple positions. I think we need to really be looking hard at our opportunities and options within house.
Okay, thanks, Patty. Steve, sorry.
Patty, sorry.
ahead, John.
Your meeting, Kelly.
I'm going to have Steve jump in with his question. Go ahead, Steve.
Yeah, I'm tagging on to what Patty said. I was thinking kind of the same thoughts. It really is a bigger budget discussion. I think there are quite a few unfilled positions in the county right now that we're not filling them because we're not sure of where our budget's going this year. But if we do have to have a reduction in force, we definitely, I'd say, take the people who their position is being eliminated and offer them the opportunity to be one of the contact tracers. Or if we could even solicit amongst all the departments if they feel like they could do kind of a bare bones operation just to get us through this period, and we're able to give up a person to be a contact tracer temporarily. I think we should do that. It's following along with what Patty said, to use our in-house people first before we go outside looking to hire additional contact tracers.
I also have a couple of questions, John, just to help me understand how we've stood up this team so far. What departments have we pulled people from?
Yeah, so it's a combination. Some are law enforcement, and so and I think a large number actually are coming from law enforcement in the city, and that is probably one of my bigger concerns as more activity is reintroduced. I'm not sure that's as optional a resource. I'm trying to remember the county departments. I don't have it right in front of me, Kelly. Not enough screens, I guess, but we have trained from some other county departments. I think those may be a little bit more sustainable. And then we've also had some support and partnership through community health services to build that capacity.
And then another question I have is, we know our public health department is young. What would a comparable kind of mature public health department staffing in this realm look like? If we were trying to think ahead for like a measles outbreak, what would that look like? Because I do want to think about this in terms of, how do we build stronger, and how do we build capacity that doesn't just help us here, but can help us, so we're not scrambling in the future, and think about that too. So it would help me to just understand, if this were an ideal team to start with, what would we be starting with?
Yeah, so according for the epi and contact tracing, we would probably really be closer to 2 or 3 on an ongoing basis. But this pandemic obviously has a much broader scope.
Sure.
What we can bring back, Kelly, too, is there was the study that was done about public health, and we talked a little bit about it during the budget in terms of what they saw the local kind of ongoing staffing being. And I think that would be a good starting point, because we're definitely much lower than that going into the pandemic, as were most counties. Mm-hmm. But that, I think, provides a good baseline. I will tell you that this is surge capacity, particularly related to COVID-19, though. But we can certainly do that comparison with the study that was done last year for public health.
And then finally, John, in all of my own hustling to get funds and reimbursement and all that for us, this to me is the area where I think we're most likely to get reimbursed, is testing and contact tracing. These are proven public health strategies. These are the commitments that we're hearing with regards to, what would be reimbursed through FEMA or the CARES Act or from the state. So, you know, I know that we can't say, okay, we pay this out and we'll get this much back right now, but I do want to just have an understanding of, you know, how long will our emergency declaration go for that would let us be eligible for these type of reimbursements when we're looking at a 12 and 18-month payout?
Well, I think you're going to probably keep those, I would imagine, until there's either a medical intervention or, you know, herd immunity has been achieved and it's no longer a significant threat. I don't see us coming out of that, those emergency declarations. Now, that said, CARES Act funding, we have received no guarantees of CARES Act funding at this point. Jurisdictions of 500,000 or over were 5 counties in Colorado qualified for that funding out of 64 counties. So there's still conversations, I believe, happening at the state level as to whether the state may voluntarily provide assistance to local government for COVID-19. Bless you, Greg. But no worries.
That's not a good sign.
But we have not had any indication that those dollars are coming from the state. The last federal bill had no funding for state and local governments. There's conversation about potentially the next bill having funding for state and local governments. Frankly, my understanding is the politics of it are such that there's a concern that if funding is provided to state and local governments, it may encourage public health orders to be in place longer rather than building the infrastructure to actually reopen safely. And so those are all the kinds of conversations that are going on. In terms of the FEMA reimbursements, that's not cut and dry either. You get what's called 75-25 money. 75% of eligible costs can be reimbursed through FEMA. The difficulty that local jurisdictions are going to have in this event is when did you go from actually responding to the event and into recovery, and will they view these positions as a temporary ad that qualifies for that reimbursement, which we of course hope they would, but that is not guaranteed, or will they look at it as a local resource that needs to be there on an ongoing basis. And so in talking to Ann Driggers, there's a possibility all or some of this may be eligible for FEMA reimbursement in the back, but it is not clear cut. I think the other thing that we need to consider is that every state for the first time in our history has an approved disaster declaration, and every state is incurring these costs. And my sense is FEMA will need to narrow their scope of what's eligible for reimbursement in order for it to be affordable.
Okay, thanks.
Kelly, let me just tag on
Yeah,
real
Patty,
quick.
go ahead.
John, that was the specific things I just spoke with Senator Bennett about last week, was really emphasizing the need to really be looking at FEMA and FEMA reimbursement, especially for those communities, rural communities, who are being left out of the general funding scope. Michael Bennett's office, Senator Bennett has been on top of this from the get-go, looking out for small rural communities around the country, and of course in Colorado at the forefront, but he's getting a lot of support from other senators and congresspersons. I think that's a direction we need to just stay in touch with Senator Bennett's office to see how we can clarify and move that forward. And I know we have to understand and take into consideration we might not get these monies, but we need to be a little more proactive and I think really work on getting these monies to reimburse us and really work on taking action with our state and local representatives to say these are the issues coming down, and I think we need to have a stronger voice in doing so, or we might as well just step aside and let the money go elsewhere. So I think that's something we should be taking on. We can do that as the Board of County Commissioners because we have those connections. We just need support from staff to help us do so.
And I can talk about in open discussion sort of movement on that front. Because I've been having lots of conversations, as have our county representative groups too.
Perfect.
Yeah. So we do have a lot more to discuss that's pretty meaty in the next 40 minutes. And so any closing thoughts, commissioners, from this? John, do you feel like, I would like to hear what departments we're pulling from. I do think we need to think, like Patty is saying, about what are the alternates that we can, do we need to close something down internally to be able to staff this up? That we need alternate ideas besides just hiring out for 18 people.
So if I could feed back what I think I'm hearing in terms of concern is that there's understanding of the need for the surge capacity to do the contact tracing, the consumer report. I think the concern that I'm hearing is the how. You'd like to see a different, an alternative brought back that may be more financially sustainable in how we get here. Is that a fair summary of what I'm hearing?
Yeah, and I think it's also where some of these staff people can be coming from. And the other thing is the numbers. I mean, I'm not necessarily comfortable with, I just so you know, let me just be really clear. I more than appreciate the job that Public Health and the Board of Health do. Their job is to protect public health, first and foremost, which I think we all are very supportive of. The job of the county commissioners is to protect the county as a whole in its entirety from every aspect. And so we have to look at that bigger, broader picture. So when we are making these decisions to support public health, we have to keep the rest of the county in mind as we move forward. And I think that's critical. That's the job that we were elected to do. And I think, again, we were elected to be the leaders in that, not necessarily the followers in that. And I think for us to get more information, we'd be able to lead in better direction.
Okay, everyone good? Greg, did you have a question? Go ahead, or comment.
Quick comment. I agree, and I think Johnny sums it up well. I do think that we've done a great job flattening the curve so far. The community realizes it. We appreciate it. But we also are told that we should anticipate a surge that could be bigger coming in the fall or later in the summer. But we have bought ourselves some time to really drill down on this and spend some time with it. So I'm comfortable moving forward, examining this, looking at where the staff, where the money is going to come from, but I know we have a little bit of time. And so I'd like to encourage everybody to take a breath. Let's keep examining this, and we know we've got perhaps a couple of months to sort this out. I'm hoping I'm right.
I wouldn't say a couple of months. I think to have this infrastructure, it's going to take a little bit, regardless of what solution we come up with. Whether it's retraining, moving, whatever it is. It is going to take some time to build this bench and get people trained. It's not something you can just bring somebody in, sit them down, and say, "This is your job now." And so. I do think we're going to need to make some decisions and get some direction fairly quickly so we can build this infrastructure and safely try and resume some normal levels of activity. But I think what I'm hearing from the board is you need to see some alternatives that are more sustainable going forward.
Okay, I think I saw Steve's hand first, then George.
Okay, thank you. I see this as really an important part of opening up our businesses again, because there will be more people coming down with the virus. and we're probably going to have to live with this for a year or two, probably looking at it realistically. In order to open up the businesses, and there's a huge amount of pressure from different parts of our community to allow their industry to reopen, we're going to have to learn to live with the virus. And part of learning to live with it is having the contact tracing in place and having a really workable system that we can find people who are sick, isolate them, find people who they maybe have passed the virus on to. So I think we're on the right track. We need to do it as soon as possible within what our budgetary limits are and our constraints that we have. So I urge you to pursue all these different options we have, John, as quickly as possible.
Thanks, Steve. George, go ahead.
Yeah, thanks. More of a sidebar comment, because as Steve said, we are hearing more and more from businesses who need to reopen. We want to try to get our community back where we can do that. But in terms of the long term, I think our goal is to ensure that Pitkin County, Aspen, and Snowmass are going to be safe places to come to. And because that's where our business comes from, the outside. And the more we can do to assure that happens, the better off our economy is going to be in terms of bouncing back. I don't see a lot of people who are going to want to go to New York City, right? But we should be able to handle this and ensure the public that, yes, Pitkin County is a safe place to come to and visit because of all that we're doing. And I think that's important to remember.
Good segue.
Okay.
So
All right.
funny, George. Can I go to the next slide? Because that's Kelly, are we?
Yeah, we're good. Let's keep going, please. Thank you.
Okay. So this is draft. There's some work being done today with representatives from the business community on what I'm going to talk to you about. But in your memo also and earlier this week, there's some preliminary discussion with the Board of Health. Incidentally, there is going to be another Board of Health meeting this week where we'll talk about this roadmap and potential timing in more detail. And so what I wanted to do was a high-level overview because there is a lot of information, but the key recommendations from the Board of Health were to really begin aligning with the state's safer at home order with the exception of a few areas. And I'm going to talk about those in a second. But and the safer at home order is another level of really beginning to loosen our public health orders as we have, as everyone knows, done a really good job suppressing the virus. And so it starts with 5 commitments and five criteria that need to be met in order to move through the roadmap. And the commitments are the individual ones that really we've been talking about a lot. None of these should be a surprise now. Keeping your distance, washing your hands, face coverings, stay at home when sick, and if you're symptomatic, we'll seek testing immediately and self-report if symptoms are experienced. In terms of the criteria that will have metrics, measurements really built around, Pitkin County sees a sustained decrease in the number of COVID-19 cases. That's 14 days is what we're looking for. Hospitals continue to be able to treat patients without resorting to crisis standards. Testing can be and is performed for all people with symptoms. It's really important that we start to actively do some outreach to portions of our community that may be a little underserved or not accessing testing as it is now. Active monitoring, that's the contact tracing, and then clear protocols are in place and evolving as our knowledge of this virus evolves, that require physical distancing and helps businesses successfully reopen. And so there are a ton of these slides. So what I am going to focus on is our current public health order is in gray. On May 9th, we are proposing to go to what we're calling phase 1 reopening, the green, which is really aligning with the state public health order. And there are going to be some exceptions, and I've marked those with one of these blue arrows here. And really, I think what we need feedback from the board on right now is we're not going to change the state's public health order, but it would be good in those areas where we're looking at deviating from that to have some conversation. But then also looking at the phases then of reopening. So phase 1 is aligning with the state's public health order. Phase 2, which we would move to if those criteria are met, would be increasing the group and gathering sizes and introducing some new activities. And then phase 3 would be a more significant loosening. And so in terms of our next public health order, one area where the proposed Pickens County public health order that is discussed at the Board of Health has to do with face coverings. They are recommended in the current Pickens County order. They're also recommended in the state order. In the phase 1 reopening, they'd be required in all public buildings and businesses, and outside if you're within 6 feet of others for longer than 10 minutes. And those others would obviously be those outside of your family group. This aligns right now with what most of our municipalities, I think Snowmass is considering theirs tonight, are doing with masks. And I can just go through all the differences, Kelly, if that would.
It'll take the whole 40 minutes we have left.
Mm-hmm. Okay, let's just check in. Does anyone have any thoughts on face masks right now? That's sort of yeah, Steve?
So, John, just to get it straight, the state is just recommending, not requiring, and that's the difference that we would require the face mask?
That's correct.
Okay.
The state is requiring
stricter than the state in this case. Okay.
Okay, Greg, go ahead.
I was going to say that I think we should really be working to get in line with the state to make things easier for everyone as much as we can. But with our municipalities being more stringent regarding the required masks, I feel obligated to go with them. I think that makes the most sense. We need to make mask wearing something people just do as a matter of course. And you know, hopefully people will feel awkward not having a mask rather than wearing one once you get past wearing one. So I guess I'm going to go along with this because the municipalities are. If we see a relaxation on their part, I think as a group in our valley, we should try to remain together in our position. That said, you know, any deviation from the state just causes a lot of confusion, as we all know. So I certainly want to move back toward being aligned with them as best we can.
I'm going to jump in here that, you know, I'm not sure about that, Greg, actually, because, you know, the state is not even following some of the CDC guidance as far as looking at a 14-day reduction in cases before they're starting to unwind. So, I do think we really need to retain autonomy and thoughtfulness about this, and I'll just leave it at that. I do have a question for John. Just when we're reading this table, I'm not sure how to interpret continued guidance. Is that something that still needs to be worked out? I would think we would want to kind of set the expectation for behavior as soon as we can, so people can start to think, what is next ski season going to look like? So if you could explain that, please.
Yeah, so Kelly, you've got it right. We're working right now on COVID business safety plans by sector. So that's being discussed for retail, actually, I believe right now with ACRA and a number of businesses. We'll be looking at lodging, we'll be looking at outdoor rec. What we believe will happen is that each one of these phases, that guidance will continue to evolve. And so right now we're working on the phase 1 guidance. We will start on phase 2 guidance. One thing that everyone needs to keep in mind is we didn't even detect this virus in the US until January. And so a lot has been evolving about what guidance is, whether it's coming from CDC or CDPHE. And so the phase 1 guidance that we're working on now will be a baseline. And we would anticipate continuing to work with these sectors to amend and change that guidance, either with new knowledge or new levels of activity. So we are not going to have it all lined out for phases 1, 2, and 3 right away.
George, you had a question?
Oh, just a comment. I support being a little more restrictive. When you look at what governors are doing in states around the country, they're making decisions, I believe, more on a political rationale, trying to address all of the different constituencies. And I think it's important that we do the same locally and acknowledge that our situation is certainly different than other communities around the state. So I believe that, as Greg said, we should have consistency, and we should have consistency beginning with our municipalities and counties within the Roaring Fork Valley.
Thank you. Patty, go ahead.
Yeah, George, that being said, in light of the fact that so many, majority of our retail businesses, restaurants, lodges, retail, are within the municipalities, not within the county, I would anticipate that the city may choose to start wanting to step up the reopening of, for example, restaurants with the 6-foot distancing, with the same kind of protective parameters as we're doing we're doing right now with retail. And that may come sooner. My concern is, so if that happens, where do we then follow in on that, since the city has police power and they obviously can do things above what the Board of Health or our health department recommends? And the other question is, in light of the information we're hearing, it's very likely, if we continue to keep on the pace that phase 1, phase 2, and phase 3, we may end up losing 50, 75% or more of our locally serving businesses, our local businesses within this community. And then we, as the Board of Commissioners, need to look at that economic impact as to then how do we recover from that. Not to say that public health is not a priority, but in light of that, we have to have some kind of thought process that includes protection of public health into protecting economic sustainability in our community, because the impacts of the economic sustainability or lack of sustainability is going to be crucial and devastating if we don't pay attention to it now. I think there should be some discussion. Do we stay in these silos of the green, the blue, and the black, or maybe there's some areas within those that makes sense based on the numbers of tests that come back positive, which, John, I'd like you to fill us in on the latest data on that before we leave this meeting. And to where we're going. Do we have to wait 6 weeks to make a decision, or 4 weeks, or 8 weeks? Or are there some things we might want to be able to take into consideration sooner than that? John, I know you don't agree with me on that, but.
No, not necessarily, Patty. So why don't I just talk about timing, because I know you guys have the memo, and that's been a big area of concern. But based on how we're currently performing on those 5 criteria, you know, the phase 1 we'd go into this week. And really the big difference there is going to be the reintroduction of non-essential retail. And we're still in off season, so we're not expecting that there's going to be necessarily a whole lot that reopens, but probably some with safety guidelines. Given where we're at with testing, because we have been performing more testing of mildly symptomatic, and we're not seeing a big push in cases, that would put us, I think there's some decisions here on phase 2, and we'd like to talk to the Board of Health about these this weekend, or this week, Thursday. If you go with the 4-week, kind of the minimum between guidelines, you'd be moving to that blue phase, which would be lodging, restaurants, all with social distancing guidelines and such, opening on the 6th. Or if you align with the state order, which runs through the 27th, just past Memorial Day, that would be another option that right now the data would seem to support. You know, the state order will supersede ours. And Patty, to your point earlier, the municipalities or the county can be more restrictive, but not less restrictive.
I'm well aware of that, John. Well aware of that.
Okay. I wasn't sure from the earlier comments. Yeah. And then phase 3, then the bigger reopening would probably be 6 to 8 weeks out, which would be July 18th to August 1st. So just to give you guys some.
So John, to help focus our conversation, we have 20 more minutes. The topics that you think, can we focus on the topics that you think are going to require most deliberation? Because I think our Board of Health members will need some of that direction before Thursday.
So I think there's going to be 2 or 3 conversations that pop up. The first is, when do we look at this move from phase 1 to phase 2? I think there is legitimate arguments to align with the state order, which would have us going to the blue level on presumably the 27th. So have our current public health order run through the 26th, or the 4 weeks out to June 6th. We do not see the data coming where we'd be on a 6 to 8 week kind of time frame. So the timing of those moves is going to be one thing that I think is going to be a topic of discussion. The other is going to be the quarantine question for second homeowners coming back, non-resident homeowners quarantining for 14 days. I do think there's going to be a discussion that if we're anticipating having a certain population of second homeowners in our contact tracing capacity and testing capacity, which we are, does it make sense to keep this quarantine requirement or to treat them like we would a resident, and with the expectation that they be tested if symptomatic and then go into the isolation quarantine? Those are the things I think are going to be most heavily discussed.
Okay, comments on those topics from the board? Greg?
You know, as you all know, we're getting a lot of comment from the restaurant community, the lodging community. There's been a lot of confusion. So many dates have been bounced around regarding openings that I think they're all, you know, we really have to make an effort to be clear with whatever we end up with regarding dates. I would certainly support looking at going a little earlier, the 27th of May, but I also would like to do it with some real interaction with the restaurant community and our public health department, so we can look at what they're thinking. We've had some great suggestions come in from the community on how they could work, the protocols. I want to see interaction between, and I know we've got a busy staff, but this is important to get this right. If we collapse our economy any further, it's going to be tragic. So I would like to see us take the chance and move it up to the May 27th with restrictions and, I'm going to say, scrutiny, looking at the way the restaurants are opening or, you know, getting ready to open. If they can phase openings, if they can work on expanded outdoor, there's some creative ideas on how they might be able to work. This may be the summer where we take the traffic out of downtown Aspen and open up the streets for cafes and things so people can separate and we can still have an economy. I think those sort of things, we're obligated, I feel obligated to hear what the community is telling us and to work with them on this. It's been impressed upon me, and I think everyone else, just how grave this is. And I think we're doing a good job so far, and this is an opportunity to really understand what the possibilities are.
Patty has a question.
Yeah, I just want to get it so the public is clear. What the Board of County Commissioners' role is in all of this. That it's my understanding, and John, please correct me if I'm not getting this clear or stating it clearly, is that by the state that gives authority to the Director of Pickens County Public Health to issue these public health mandates under the guidance or authority of the Board of Health, which is an appointed board, a Board of Health. The Board of County Commissioners just weighs in on those, can give recommendations to those. So for the public to know, and the public keeps contacting the Board of County Commissioners, we can give advice and recommendations to the Board of Health, but the Board of Health is really the one who sets the public health mandates. Is that not correct?
Yeah, Patty. So the Board of Commissioners appoints the Board of Health, and then the Board of Health is vested with certain authorities, and that includes the approval of the public health orders. The county does have a voting rep and an alternate, as you're well aware, yes, on the Board of Health to have our voice there. The public health director also has independent authority to issue the public health orders so that they can be issued in an expedited way to address a public health emergency.
Right, thank you. Just so the public is aware of that.
George?
So what I would suggest is, well, first of all, we need to be nimble and flexible, obviously, because we don't know what the future holds. And if we know we're starting phase 1 on May 9th, which is coming right up, which is great, I think that if we wait after that opens up 10, 12, 14 days max, with 14 days would bring us to May 23rd, we'd have a lot more information, and then we could still have the Board of Health make a decision whether to open up earlier or hold it to June 6th. And I understand that businesses will need some advanced planning time as well to try to prepare for an opening. So I think there's some flexibility in there without actually putting a hard date on right now, but knowing that we've got some leeway if we want to see if there's going to be a surge in the next 2 weeks after we open up some more businesses on May 9th. So that's one point, and then I'll just finish up. In terms of the second homeowners, same thing. You know, we know our second homeowners are coming from around the country. They're coming from urban areas. They're coming from Florida, New York, and Chicago. And so I think, as was stated earlier, point of entries, if we can capture as many people as we can at the port of entries, which is our airport, perhaps, and through the property management companies who are handling their condos or their homes, we could do some quick testing if they're symptomatic, and then require quarantine. But again, we need to try to, I think, stay a little flexible, but have the ability to be able to enforce and quarantine if that's necessary.
George, can I just, because what I heard there is kind of the same requirements that residents would be under, which is if they're symptomatic, test and, isolate if they're positive.
Right. And this is just going to be for second homeowners, because we have this whole other issue with lodges and with campgrounds, and that's a whole nother Airbnbs. So we're just focusing on second homeowners who typically spend perhaps more than 30 days here.
Mm-hmm.
Steve, go ahead.
I could see allowing the restaurants to open on around May 27th. I think a lot of the anxiety has been that the dates have been uncertain as to when lodging's opening. Maybe the restaurant date was more firm at June 6th, but I think that's still flexible. If we still haven't seen a reduction in number of cases, that would be extended further into the future. The community's done a terrific job. We've been number one in the whole country on people really not traveling around, squashing the curve. We didn't just flatten it. They did an awesome job on squashing the curve, and we need to put some trust in the community that the restaurants will have really follow the guidelines and do a really good job of it, because people have shown that we can do a good job. And I would really like to repay the community to have some trust in the different industries that they can reopen. They have these guidelines they absolutely have to meet. If they don't meet them, they are going to potentially be shut down again. And that's the threat that we would hold over them. But I think being able to set a firm opening date right now or this week by the Board of Health would be really helpful for the long-term planning for the industries. Same way for the lodging industry. I mean, I notice on our phase one that the lodging industry can open to a small degree on May 9th for local residents, for emergency, for essential business kind of things. If we could set a firm date sometime in June instead of this nebulous thing, somewhere a 4 to 8 week kind of a period is hard for them to plan for. But if we could make a definite opening date that they can plan for, they can really work on getting all of their precautions and their guidelines and any structural changes they need to have in place to reopen on that date, I think they would do it because it's in their interest to be able to reopen. The community would respond to that, I think. Thank you.
Yeah, and just in case I wasn't clear, we were looking at, between those levels, reintroducing activities in parallel. So once you reach that next phase, it reintroduce the restaurants with the guidelines and the lodging. We do think a lot of these are probably going to need to go hand in hand in order to be successful with each other.
So I'm going to weigh in. Steve, did you have another question?
Well, I just wanted to bring up the fact that there's been communication with other mountain community county commissioners wanting to know what are our reopening dates and wanting to have some coordination amongst the different counties. So I think it would be worthwhile to look at what other counties in the mountains of Colorado are planning to try to coordinate with them, at least to some degree.
So, I don't know. I'm going to take a different tact, I think, from what I'm hearing, because, you know, when we're talking about earlier opening date, we're fundamentally undermining the recommendation to allow a minimum 4-week period to assess what is happening. And, you know, I think we need to think about how the virus behaves and what we don't know about the virus as well. For example, you know, are we going to have more asymptomatic people in the summertime because of the virtue of it being summer and the way viruses act differently in the summer? And, you know, will onset of symptoms happen later in the 2-week, you know, the 14 days? And so if we're only looking at the 2 weeks from change to change, or only 3 weeks from change to change, are we really going to be able to assess whether we continue to have a 14-day decrease in cases? So, you know, I think we need to say whether, yes, we want to fundamentally undermine that recommendation or not. And I'm struggling with that. I also, you know, don't necessarily think the activities in each phase are comparable to one another. You know, looking at how we might open, you know, child cares here is going to behave and respond differently than how we open retail and restaurants, you know, restaurants where it's going to be more difficult to keep people in farther proximity, et cetera. We're also opening that not just to our county, but, you know, now we're saying we can travel within the Roaring Fork Valley and inviting people in from down valley. So our population, this is when our population numbers really do start to go up, and our opportunities for bringing the virus in from outside are going to start. And so closing the time periods that we have to measure what's happening, I think might set us up to have to ratchet back down and strengthen things back down again. And what I don't think we've done is had the conversation to figure out, can we do both? Can we protect public health really well by following this recommendation that we've heard about the 4 to 8 week periods? And can we help try to mitigate the you know, the fallout from that? Like, is there ways that we can work with our economic community, our business community, to find more creative solutions or find ways to bridge their losses while still protecting our public health? And I don't think we've done that necessarily as a board. You know, we had that conversation last week to throw around ideas that were pursued in the past in the recession. But we're opening up we're talking about opening up before we've had the full conversation about, you know, what can we do to help people stay solvent without jeopardizing public health. So, you know, that's where I'm at. I'm a little uncomfortable with the notion of not following the recommendation that public health has given us. So I'll say that. We have 4 minutes. So that's for that's my input for our Board of Health appointees.
Let me jump in on that, though.
Yeah.
As I think within that 4-week period of time, if somebody will give us the numbers of how many tests we've done and what the positives are, because I don't know where we stand today versus where we stood a couple days ago. I'm assuming we've had more test results come in. That gives you some kind of trend. Okay, we saw 1 this week. We saw 5 since we opened construction. I'm just bringing up numbers. So I think we would have some kind of inkling or some kind of idea by tracking the number of tests done, the number of positives as we open up businesses, which construction was the one we just recently opened, which would give us some kind of a
I know that's the global approach, but the time matters. We've only been open for construction for 6 days.
Well, no, but
we may see cases at the end of the week that we didn't see at the beginning of the week.
But I'm trying to
time matters.
say that we will see a trend, I think, within that 2 to 4 weeks. So we won't say, oh, at 2 weeks we didn't have any, but we had 3 more or 4 more, and we only had 1 the week before. So I think that'll all be taken into consideration, rather than we know how long it takes the government to work. So if we wait for 4 weeks to get all the information without starting to think about things, it'll take us another 2 weeks to think about it and another 2 weeks to do anything. So we're already out to 6 to 8 weeks, and by then we're going to have even further collapse in the economy. And I don't think we're going to, by opening up lodging, say, for example, X% of lodging when the time is right, with only guests coming from within Colorado, just throwing out some ideas of possible ways we could start to gear up, or restaurants that could serve people, X amount of people outdoors now that the weather's changing. I think there's some flexibility in opening up those industries, like we did with construction management plans and all of that, to see how that works. And I think we can take it safely to protect public health, because Kelly, I think you're right. What do we do to bridge the financial losses? We don't have a fund that we can go in and pay restaurants to stay open. We just don't have that. So we're going to have to find a way to have restaurants be able to help themselves to stay open for the long run, or we're going to lose an extreme amount of our economy in this community, which will take us years, if ever, to recover from.
George, go ahead.
Well, typical of Pickens County and Aspen, you ask 5 people for opinions, you get 6 different answers.
I'm glad I asked.
But I think Greg and Patty have heard the issues, understand the concerns, the gamut of the concerns, and it'll be a good discussion that you guys will have with the Board of Health.
Trust me, George, we will.
John, anything else you want input from us on in the last minute?
Well, Kelly, it strikes me from this discussion that I've got a few OBECs to use. So one, next week, we'll come back, we'll come back with some different alternatives around budget and how we do fund this public health infrastructure. Because however we get to that, I think it's going to be important to have it in place as a public health strategy to reintroduce economic activity. 2, we probably need to have these meetings or these kinds of opportunities for discussions. I heard a lot of asks for data and where are we. And I think we're getting to a place now where we can make this a little bit more regular discussion about, where are we on those 5 criteria? What does it mean for the steps, and where are we in the conversations with our sectors on guidelines and how we're moving forward? And it'd be good, even though the decision-making may reside, with Board of Health, I think these conversations to inform the representatives and just for your general understanding of where we're at are important, and we should probably just schedule this kind of time now on a weekly basis.
Well, John, I think that's a great idea, because if we schedule on a Tuesday work session, we now have Board of Health meetings scheduled every Thursday. So that gives us time to have comments and maybe digest the information before Thursday.
Great. Okay, thank you so much. Really appreciate all your work, John. I know it's
Thanks, Kelly.
11:00.
Appreciate it.
Okay, I think I saw April join us, April Long. See if we can get her on the screen.
I did see her peek in. There she is.
Hey.
Hi.
Hi.
Welcome. So nice to see you.
How are you guys?
Good. April wears a lot of hats, but she's joining us today from the Rudai Water and Power Authority.
Yes, I am. And I have a presentation for you guys, but I'm wondering exactly how do I make the presentation visible?
So if you wiggle your mouse over the screen, sorry, this is Andrew, Pickens County IT. You should see a green button down the bottom in the middle that says Share Screen.
Okay.
And if you click that, then you'll select which window you want to show, and then in the bottom right, you'll click Share, a blue button.
Okay. Okay.
Great.
Good job.
April, Greg here. If I could, I just wanted to say that I did invite Kathy Chandler Henry, who's our board chair for RWAPA, to join us. I don't know if she'll be able to, but I just sent her the link and told her that we're starting now. So we might get joined by Kathy if anyone sees her pop in. Thanks.
That would be great. Okay, I'm just going to try to get this in slideshow view. Does that look like a regular slideshow to you guys right now?
Yeah, it looks
and
great.
It doesn't look like one where you can see my notes. It just looks like the regular slideshow.
That's right. We cannot see your notes.
I thought she said her nose.
Good. That's where all my secrets are.
It's slightly large. It's slightly big on my screen, so it's getting cropped. But other than that, it's
getting cropped. Okay. Let me know if you're like, I don't know how to make it smaller.
Well, it looks good here and for grassroots. So
actually, it's great looking picture.
We'll adapt.
Okay. Awesome. Well, thank you guys for giving me the opportunity and time to present to you today. I know that you're dealing with a lot more significant issues, and hopefully this one will not be as hard on your head to think about as what you've been doing. And we really appreciate the work that you have been doing. So I've been the director for the Rudeye Water and Power Authority for 2 years now. That was a position previously held by Mark Fuller. And the last time that I talked to the Pickens County Board of County Commissioners was 2 years ago when I was taking over for Mark. And so I'm happy to be back here today to tell you what I've been working on and what the board has been working on and what our plans are moving forward. And I just wanted to give you some of that background information of who we are. And I know you guys are all very familiar with what RWAPA is, but perhaps people watching from home aren't. And so I'm going to give you some of that information and then also talk about what we've been doing, what our accomplishments are, what our plans are moving forward, and then open up an opportunity for us to have some dialogue about what ideas and thoughts you may have for how RWAPA could be of better service to Pickens County and to the watershed as a whole. Let's see. So you'll hear me often call the Rudeye Water and Power Authority RWAPA. Some other names that it's been called is RWAPA. So that's just our acronym there, RWAPA. It's a little easier to say than the entire time. But RWAPA's mission is to mobilize resources and influence to benefit the waters and the communities of the Roaring Fork watershed as a whole. This is kind of a funny name because the Rudeye Water and Power Authority has no water, no power, no authority, and does not specifically relate to Rudeye. So I think that it can be a little bit confusing for everybody to understand what it is we do. That is a joke that Mark used to say, really made me better understand exactly what RWAPA does. We were formed in the early 1980s to collaborate and corroborate around a lot of the development of hydropower at the base of Rudeye. And so that's where all of those kind of terms came from. We really quickly became an organization that was developed around the ideas of being able to protect and preserve the water resources of the Roaring Fork watershed to the benefit of the communities that it's serving. And so it's a quasi-governmental organization with a board comprised of an elected official from each of the jurisdictions in the Roaring Fork watershed. So we're looking at Aspen, Snowmass, Basalt, Carbondale, and Glenwood Springs, as well as Pitkin and Eagle counties. And so your representative, as you probably know, is Greg Poshman. Greg has been on the board since I started and has been a great representative for Pickens County on that board. So there's the board of elected officials that direct what I do. I'm the only contract employee to the board, and I'm part-time. So this is not an organization that has extensive staff. It's simply an organization that acts in the interest of the watershed and kind of like a council of governments around water issues. Garfield County did participate in RWAPA for many years, but hasn't in the last few years. So I think that this organization was developed because recognizing that, like many other resources, water does not recognize jurisdictional boundaries. And it's in our best interest to collectively think about this precious resource that we have as a region and to kind of collaborate around that issue rather than to think about it individually all the time as individual jurisdictions. So we are essentially the eyes, ears, and voice for the entire watershed. We work locally amongst our jurisdictions, but then also regionally and at the state and federal levels. Let's see. So I mentioned that Greg Poshman is the regular board representative from Pitkin County, but Kelly McNicholas Curry has also been participating and is familiar with the work that we've been doing. We meet on a quarterly basis. So there are several watershed organizations in the Valley, most notably the Roaring Fork Conservancy, as well as Pitkin County's own Healthy Rivers and Streams Board. And so I think at times it can be confusing about what do all these organizations do and how are they different from each other. And what I will say is that RWAPA does look at policy and planning rather than education and projects, which is what the other organizations seem to focus more on. While we also do look at education and projects, and I'll talk about some of those in just a second. We also work on advocacy and, like I said, representation at the local, state, regional, federal levels. One of the other big roles for RWAPA is to foster implementation of plans, most notably the Roaring Fork Watershed Plan, which has action items identified for all of the jurisdictions that touch water in our watershed. And so that plan really never landed with any particular home, and I'll talk about that more in just a little bit. Another example of a plan that we work to implement or foster implementation on is on the Regional Water Efficiency Plan, which is another, I'll also talk about that more. And then most probably notably and recognizably, we sponsor the A&S inspections at Rudeye Reservoir. So those A&S inspections, that stands for Aquatic Nuisance Species. It's basically we're protecting Rudeye Reservoir from mussel invasion. Mussels are an invasive, non-native species that are kind of making their way across the United States in the last few decades, and they cause extensive damage to infrastructure and to shorelines and to recreation, to water quality, and they proliferate extremely quickly. And so you can see in this picture on the right, that's an example of a pipe from Lake Mead, and the progression from the clean pipe to the infested pipe was just 18 months. So it can cause huge problems for infrastructure and for recreation. You can see the shoreline there. That's the shoreline at Lake Powell. And so the program at Rudeye is a little bit interesting because Rudeye Reservoir is owned by the Bureau of Reclamation. So they own the dam and the water within it. They contract that water out to different water rights holders. The reservoir sits on top of Pitkin and Eagle County. The land around the reservoir is owned by the Forest Service, and the mussel inspection program is guided and directed by the Colorado Parks and Wildlife. And so there are like 8 different jurisdictions that have to come together at Rudeye specifically in order to implement this program. And so RWAPA kind of houses all of that. And we're in a different situation than other reservoirs in the state because we're not a state park. And so CPW can't just implement the inspection program the way that they do at other reservoirs in the state. So this program has been in place since 2008, and RWAPA has been the lead sponsoring agency on that, and we've been expanding and improving that program since we started, and working to improve the protection that we provide for the reservoir. So we're kind of balancing this need for recreation on the reservoir as well as the prevention of mussels entering the area. So we have to provide this inspection in order to allow people to recreate on the reservoir. And so in 2019, we ran a full program, which means that we had inspectors there basically from sunrise to sunset every day of the week from May 1st through October 31st, which is the kind of the boating season there. And we intercepted 6 mussel boats in 2019. We intercepted 2 in 2018 and none in any of the years prior to that. So you can see that we have an increasing threat, and that's true not just at Rudeye, but throughout the state of Colorado. And Rudeye Reservoir intercepted the second most boats in 2019 of any reservoir in Colorado. And so we have a lot of those boats that are carrying mussels are coming from Lake Powell. Lake Powell is completely infested with mussels. And so a lot of Rudeye boaters are also Lake Powell boaters, and that's why we see a lot of interceptions happening at Rudeye. Colorado is a mussel-free state, as well as a few of the states neighboring us to the north. But as I said, this mussel invasion is spreading throughout the United States. And the best information that I'm getting is that the reason Colorado and a few other states are mussel-free is because of this really restrictive inspection program that we have. So in addition to that inspection program that we do at Rudeye Reservoir, we also, let's kind of go backwards to some of those other things that I was mentioning. I serve as a liaison between the Roaring Fork watershed and all of the jurisdictions that our board represents to lots of other state, regional, and federal agencies. And so I've listed some of those here. One of the first ones, this HUP, is the Historic User Pool. And so that's a group of Western Colorado water users who regularly discuss how water is released and managed in reservoirs in order to meet the needs of the endangered fish in the Colorado River, as well as the irrigators in Western Colorado. So how do we balance those needs? And there are regular conversations about how releases come out of different reservoirs in order to meet all of the needs of the Western users. Now, I represent the Roaring Fork watershed in those calls. I think some of these other organizations you're probably very familiar with, but just so that we can clear up some acronyms, the CWCB is the Colorado Water Conservation Board. The Basin Roundtable is the Colorado River Basin Roundtable. There are 9 of those throughout the state, representing the 9 different large watersheds in the state. CPW, Colorado Parks and Wildlife, QQ, many of you participate in QQ and are familiar with what that is, but that's the Northwest Council of Governments Water Quality and Water Quantity Committee. It's kind of a headwaters region of government. And so part of what I do in being a liaison is taking the interest of the Roaring Fork watershed to these organizations and to these meetings, and also bringing that information back to our board so that they can disseminate that information back to you all. Some examples of that is, when I participate in these phone calls, I'm thinking about how the releases out of Rudeye might affect the hydropower plant. So I'm looking at the city of Aspen's concerns with the hydropower plant at the base of Rudeye. I'm thinking about how it might affect the environment of the Frying Pan River. So we have certain flows that are needed in order to protect and preserve the ecology in the Frying Pan, which is critical for the economy of Basalt as well as the lower Roaring Fork. So we're looking at fishing and recreation economies there, are dependent on having a strong environment, but they're also dependent on wadable flows. So in addition to the flows needed for the environment, I'm also looking at what flows are suitable for fishermen. And in 2018, we were working with a drought, and so we were working with temperatures on these rivers to try to maintain temperatures that are safe for continuing to fish within, but also safe for fish to continue to live in. And then in the winter of 2018, because of the drought, we also began to see things like anchor ice forming. And so I worked with the Roaring Fork Conservancy and the CWCD to ensure that we could get flows out of root eye that would prevent anchor ice from forming, which can really strip the river of macroinvertebrate populations. And so I just kind of give you all of that detailed information so you can see where RWAPA is trying to represent all of the needs of the community around one kind of common issue, which is the releases out of root eye reservoir. And like I said, we don't have any authority there, so it's all an advocacy role.
I'm going to have Greg jump in. He's waving with a question.
Yes.
I'm just eager for April to share some great news that she received yesterday for.
Oh, yeah.
Must have been a brilliant application you made.
I don't want to take any credit for that, but what Greg is referring to is that the Bureau of Reclamation, which has been a difficult partner in the root eye A&S program because of their inability to contribute funding, they've just recently started contributing funding, and then I found out yesterday that next year they're going to contribute $200,000 over the next.
That's great.
Make improvements. Yeah. And again, I don't want to take credit for that. That's been
go ahead.
Conversations that Mark Fuller started with the Bureau. So I just kind of carried that through. But yeah, $200,000 worth of in funding for capital improvements at Root Eye Reservoir to improve this A&S inspection program. Wonderful news. So
over how many years?
Over the next 3 years.
Over the next 3 years. And I think the one thing I just wanted to highlight regarding the aquatic nuisance species is, one, it destroys fisheries. It could easily destroy the fishery in the frying pan if it got.
And in Root Eye Reservoir. Yeah.
And in the reservoir, and certainly in the reservoir, because the mussels eat the same the shrimp that the trout thrive on.
Exactly.
So we have a fisheries issue, but also these mussels could completely destroy the city of Aspen's hydropower program. Or make it so ineffective that the city could no longer claim to be 100% renewable.
Absolutely.
So it's a severe consequence, and that's why we're taking it so seriously. And so thank you for telling us about the grant. I'm so excited.
Yeah. I know, me too. Thanks for reminding me about that, Greg. I appreciate it. And so, let's see. We talked about what happened in 2018 with the drought on the Frying Pan River. And then also we had a large fire in that watershed, the Lake Christine fire. And so in 2019, we saw some flash flood flows that washed fire, ash, and debris into the frying pan. And so another role that I played in that was in quickly identifying flow and releases that may be available from Root Eye Reservoir to flush that mud and debris out of the frying pan, so that again we could protect the ecology, the ecological system within the frying pan, in order to protect the environment and that fishery and that economy for basalt. So those are just examples of some of the things that I'm working on, because I feel like it's often confusing what RWAPA does for the watershed. So some of the other things that I was talking about, kind of advocacy and being this liaison between other organizations and how we do flow management out of Root Eye Reservoir. But part of the other role of RWAPA is in fostering implementation of some regional, local, regional, and state plans. And one of the big ones that you've heard about before is the Roaring Fork Watershed Plan. So this was a plan adopted by all of the jurisdictions in the valley and a lot of other coordinating agencies in 2012. And the Regional Water Efficiency Plan, which is a plan about how the municipalities in the valley could work together on efficiency, who could find strength in working together in water efficiency guidelines and messaging and things like that. There's the Colorado Water Plan, and where the Roaring Fork Watershed fits into the Colorado Water Plan to make sure that our needs are met in that statewide plan, and that we're also helping the state implement that plan. And the Basin Implementation Plan is a piece of that, of the Colorado Water Plan. There's also significant funding available through those two larger plans that I help projects and entities in the Roaring Fork Watershed connect the dots so that that funding is available specifically within the Roaring Fork watershed so that we're able to receive that funding. And then lately we've been hearing and working a lot with stream management plans. The Roaring Fork watershed has 2 stream management plans, which is kind of more than the rest of the watersheds within the state. Those plans are working, you know, water's this critical resource that we're seeing less and less of. So when we use it, we want to be sure that we're meeting multiple needs in the way that we use water, rather than meeting only one need and not thinking about water as a whole and all of the beneficial uses that we could be putting it to. So in the last 2 years, I've spent a lot of time working on the Roaring Fork Watershed Plan. We, with the Roaring Fork Conservancy, decided to update this plan, and kind of, rather than update it, we weren't making any changes to it, but we wanted to look at the status of all of the action items that came out of that plan and how entities and different agencies were doing in checking off the list. So what had been done since we adopted this amazing plan with 250 action items? What had everybody done to actually get anything done, accomplished? And so I worked with the Roaring Fork Conservancy in 2018 to check in with all of the implementing agencies on how we're doing on the action items that were assigned to them, and how we could make the watershed plan a more accessible tool for them. And we hosted a summit in 2018 to also hear from other members of the staff from these agencies and these jurisdictions, and then also to hear from some elected officials as well about progress that had been made and what we were looking at as a watershed moving forward. And so a lot of the feedback that we heard in the update of this plan was that, you know, it's a 300-page document and it's not extremely useful. Nobody is really looking at it regularly. That they need a little more simplicity to it and some, you know, for lack of a better term, some hand-holding to get through it, some reminders to get through it. And so we developed with the Roaring Fork Conservancy an executive summary, which talks about how to use the plan easily. And we developed these quick guides, which I'll show you in just a second. And we developed a web tool. And so instead of using just a hard document, we brought everything that we could into an interactive digital tool. And you can find this tool by just Google searching, sorry, you know, to brand it, but I use Google. Google searching the Roaring Fork Watershed Plan interactive tool. It'll take you to a page that looks similar to the one that I've included in the presentation. What's incredible about this tool is that it talks about just specifically the Roaring Fork Watershed in a lot of ways and puts a lot of data onto a map. And so you can see tabs across the top if you're interested in water quality, or if you're interested in water rights, or if you're interested in stream flows at particular gauges. You can access all of this information from this one page. And how that relates to the watershed plan is that we see the tab that I have highlighted right now is the action plan. And so we have data points on where projects have been implemented that were called for out of the watershed plan. And we plan to update this regularly as more projects are put on the ground. So you can kind of see, if you wanted to see where has restoration occurred, or you know, what entities are implementing conservation measures, then all of this is kind of on this one interactive map, and then you can drill down and get more information as you go down. One of the other things that came out of that re-look at the watershed plan was this quick guide. And so basically there's 250 action items in the watershed plan, and they're really difficult to sort. And it's hard to know if you as Pickens County or the staff of Pickens County are actually doing any of the actions that were assigned to them. And so I pulled all of those action items apart and gave every implementing agency their own quick guide. So this is a snapshot of what Pickens County looks like, and I've worked with Pickens County staff on what these action items are and how they might go about implementing them. You can see that it provides a reference that you can go back to the watershed plan. It gives a description of exactly, like a little brief description of what the action is. It also, as you look to the columns on the right, it gives you ideas of who might partner with Pitkin County on these projects and what are some potential funding sources. But what else we heard in the Watershed Summit is that they really would like for Roaring Fork Conservancy and RWAPA to work together to foster this. And so they wanted us to regularly meet with their staff to check in and to remind them of, these are the actions that you agreed to. What do you need? What support and resources do you need in order to get the ball rolling? Or, hey, did you know that so-and-so is doing this exact same action and you guys should partner together to get this done on a larger scale and to share the resources. And so we agreed to also host a summit where we could all get together and talk about all of this every 2 years. And so 2020 is the year for us to host this summit. And we were planning to do so in May, but have put that on hold for now. And so I'll be back to let you know, if we're going to host that in 2020 or if we're going to push that to 2021.
Hey, April, I want to check in. We have a few minutes left, and so I just want to see if you have many more slides and, see if you need any input from us. But please keep going. We still have a few minutes.
Okay. I just have a few more slides, and then I do want to get input. Some of the other plans that we're working on, and that this is going to be coming in 2020 and 2021, I've just started working with some staff from these participating jurisdictions on water efficiency and water saving. So we're looking at this regional water efficiency plan that was developed by RWAPA and the municipal water providers in the valley to think about how could we as a region promote water efficiency. And then I'm also trying to pull in the counties who are not necessarily water providers in the traditional sense, but how do we, as a region, look at what can we do to protect and preserve the water resources of the Roaring Fork Valley through our codes? And so making sure that we're thinking about water as we're thinking about land use planning and providing water for our constituents. I thought you might be interested in RWAPA's financial status. At the end of 2019, our fund balance was $61,000. We have an operating budget that gets split into 2 different programs. It's basically all of the other things, and that in 2020 was $58,000. And then this A&S program at RUDI, which is really expensive. We're paying for all of the staff there. And so that's $111,000 is what we budgeted for 2020. All of the member jurisdictions contribute to these services, and so Pitkin County's contributions for operating expenses are $5,500 annually. Those have not changed in the last few years, and for the A&S program is $15,000 annually. So just to reflect on what I was telling you, in 2018 and 2019, I spent a lot of time in housekeeping, so just hosting a retreat with the board to understand our mission and what I should be spending time working on, and cleaning up our finances and our website and things like that. I spend a lot of my time working on flows and releases out of RUDI Reservoir and on the mussel program at RUDI, and then on that watershed plan and tool. Looking forward in 2020 and 2021, I think we're going to work on improving our community presence, and so that the entire community understands what the RUDI Water and Power Authority does for them. I'm also looking at the contracts in RUDI Reservoir and what kind of flexibility they have in meeting the needs of the contract holder. In 2018, we saw that we were having to do quite a dance in order to meet the environmental flow needs and the fishable needs and the irrigation needs and the wildlife needs. And so I want to work to ensure that the contract holders have the language in their contracts that they need if and when another drought happens. I'm going to be working on those water efficiency plans like I just talked about. We will be hosting another watershed summit. In 2018, we hosted a candidates forum on water, which I think some of you participated in, and that was really successful from the candidates' perspective, and they've asked that we do a focused candidates forum again. At the time, that was hosted by the Watershed Collaborative, which is no longer an entity, but the RWAPA board has directed me to take up the slack, host a candidates forum this year, so hopefully that will happen. We'll be working with the state on ensuring that the Roaring Fork watershed needs are met in the Basin Implementation Plan update, which is happening on a state level. And then I'm also going to kind of more formalize this communication that I have as a liaison between the watershed and other organizations. And with that, I'll open it up for any thoughts that you guys have, any questions that I can answer. Again, want to provide a service to all of the jurisdictions. And so I'm very interested in what needs you have that I could meet.
Steve, you've unmuted. Do you have a question? Go ahead.
Thank you, April, for your presentation. It's always interesting to learn more about Root Eye and about the Roaring Fork watershed. My question is about the hydroelectric operation at Root Eye. Mm-hmm. There are times when it actually gets waterlogged with the water backing up into the outflow pipes of the where the turbines are, and that actually slows down the water then going through the turbines. Have you looked at anything, any possible structural changes that would reduce the amount of water logging and therefore increase the efficiency of the hydro output?
No, that's a really great point, Steve. I have not particularly looked at that, but I know that the city of Aspen has, and they're aware of that issue, obviously, and they're working on that, and they would like RWAPA's support when they determine what their potential solutions are. They would like RWAPA to reflect on, what kind of recommendation they would have and what role they could play in that. But absolutely, the city of Aspen is concerned about that and is looking at the efficiency of the hydropower plant, not just in terms of its current operations, but how it might operate in any kind of a projected future. And so in the eyes of climate change and the way that Root Eye might be managed in the future, they're trying to also project that on the efficiency of the hydropower plant. And so they're looking at all of those options, and I would expect they presented to the RWAPA board earlier this year, and I would expect that we will hear more from them in the next few years.
Okay, thank you.
Mm-hmm.
George walked away. George or Greg, anything from home? No? Okay.
Well, I'll ask one more question if no one else does. I'm curious about the Dynamo, I think is the name of it in the frying pan.
The what?
Is that still an issue, or what?
The funk that grows.
What's happening on that? Is it something we should be concerned about?
Yeah, so there's an unusual algae that grows in the frying pan called Dynamo. It's also referred to as rock snot. Covers the bottom and basically affects the ability of the macroinvertebrate population to reproduce. I know there were some evaluations done, and that the Roaring Fork Conservancy continues to collect data on how the Dynamo what's happening with Dynamo in the frying pan. And I haven't heard an update on that in the last few years. So I think that, Steve, before I kind of guess at what the answer is, I'd have to look, I'd have to dig into that a little more, let you know what the latest information is on that. And I can do that and send an email to the commissioners.
Okay, thanks, April. Patty, anything?
No, I'm good. Good. Thanks, April. It was nice to see you.
Oh, wait, George, go ahead. You have a question?
Yeah.
Yeah, thanks, April. My question is how you're coordinating with the Bureau and the Forest Service in terms of opening up or delaying the opening up as it relates to the boat ramp, the mussels, social distancing with COVID-19. What's RWAPA's role in that?
So again, we coordinate with all of those agencies to operate that entire program. Right now, the Forest Service has issued a closure of all of their facilities, and because they operate those campgrounds and the ramp, then those facilities are, and the bathrooms and waste receptacles, things like that. So all those facilities are closed, and so the ramp is not open to inspections or to launches until they lift that closure. That closure is set to lift now on June 1st. So that's the opening date that we're planning for. We work with CPW on training our inspectors and following their guidelines for inspections, and they have a COVID-19, they have been training their inspectors on COVID-19 actions. And so at other reservoirs in the state that are open, they have protocol in place, and we will follow those at Rudai Reservoir as well, which includes, when we do open, it includes distancing and includes, you know, certain protocol about what things you can and cannot touch on a boat, how to disinfect, wearing masks, all of those things are part of their operating procedures and their inspection procedures for their inspectors this year.
Yeah, I mean, just one of our concerns, obviously, once Rudai opens, we'll start seeing not only local boaters, but people coming from around the state or even outside the state. So, again, as we're trying to contain the health of our community, that just, again, everything that starts to open up and introduces a different clientele coming in could raise a risk.
Right. And if there's, you know, direction that Pitkin County wants to kind of share with Greg, and Greg, you can share with our board, we can discuss that at our next board meeting, which is May 21st.
Great, thank you.
Greg, go ahead.
Yeah, thank you. George, thank you for that question. I knew there was something else. There's a pressing issue I did want to bring up, and I know April released a press release last week regarding the closures and the protocols up at Rudai. And those basically are going according to Forest Service and the other entities involved in this. The concern I had, and I think I contacted the sheriff's office about it, was that another reservoir in Colorado actually had a break-in by a belligerent boater and fishing guide who just insisted on getting on the water. And my concern is we're going to see boaters coming back into the valley or up to Rudai. They get all the way to Rudai and discover the ramp's closed, and they may decide to just get on the water any way they can and break a rule. So I'm thinking that I just want to make sure that we're reaching out to the community and informing them as best we can proactively, so we don't end up with a situation. I think that fishing guide was permanently banned from using Wolford Reservoir for life, I think, for this. I just don't want to see this happen, because I know we're going to have some very upset boaters who have a sense of ownership about Rudai and the ramp up there. So I just want to make sure we're in tune with them.
Steve, go ahead.
I appreciate that.
Well, a follow up on that. My understanding is the Rudai Yacht Club is open, so there will be boaters going on to the reservoir there. Other people will see sailboats, or my friend out there in his crew shell rowing around, and they're going to want to get on there too, and that could create some problems.
Yeah, so those are great points, you guys. The Yacht Club is a private property, and so it's not regulated by the Forest Service, and so they are allowed to open. However, they are required to have inspections just like any other access point in the state. And so there is that. As far as it pertains to the A&S program and mussel inspections, they are required to do inspections prior to launch. Back to Greg, your point about communicating the closure with the boating community, it's a difficult community to reach when we're talking about those that are outside of this jurisdiction that might be coming in. There are signs that say that Rudai is closed before you start up the Frying Pan Road. And I also plan to increase communication at kind of where I know boaters like to stop to fuel up and things like that. So some signs at the gas station there in Basalt is what I'm planning for that. And I have started a Facebook page, so I'm trying to increase our social media presence so that we can communicate some of those notifications to the public. I did go up to Rudai on Friday to check what the closure looks like and if it would be easy to launch a boat beyond it. And they have closed the ramp at the top. And so if you're familiar with Rudai Reservoir and how to access it, they've not just closed it down at the boat ramp. The Forest Service has closed it all the way at the top. And so you can't go into the Rudai parking or driving areas at all. And they have road closed signs as well as large boulders blocking the area. So you have to have some equipment in order to break in.
Okay. Well, thanks, April. I really appreciate all of your time. It's great to see you. I appreciate the update on the watershed plan. I was curious. That would have been my question. So I look forward to using the tool and getting more informed. Yeah. All right. Hope you're well. I'm sure I'll see you in a virtual water meeting at QQ or the roundtable.
Thank
soon.
you all. Thank you all so much. I appreciate it.
Okay.
Thanks.
Take care.
Stay safe, April.
Okay. Let's go ahead. We have I think a short next presentation, and then I'll suggest we take a 5-minute break after that. But let's move on. Cindy Hubin, Brian, Paul, and Alex, an update on the permit application and tracking system. Hi, Cindy. Hi, Brian.
Hi, everybody. I'm going to let everybody get settled here with the presentation.
And I will need to share the screen, and so if April could stop sharing, I can begin sharing our presentation here.
Okay, April, did you hear that? If you could stop sharing. your
Yep,
screen.
I'm trying.
Okay.
I'm trying to figure it all out.
No worries.
I'm sorry, I've made my, I cannot figure out how to close the screen, and I've made my screen.
It's up at the top, a red box up at the top, I think is where it is located.
Oh, I see it. Okay, thank
She
you.
just closes out of Zoom. Will that? Okay. All right. I think our savvy IT folks here have helped. So Alex, you should be able to. Okay, great.
Well, thanks, everybody. Just by way of introduction, I'm Cindy Hubin, the Community Development Director, and I'm very proud of our staff and where we've come on this project. It's been a long time coming, and I think you'll enjoy some of the photos in this presentation. But first of all, I want to thank the board for your support. As you recall, you provided us with a couple extra temporary employees to help us through this development and implementation phase with what we're calling the permit application tracking system for community development. And with that, the people who have been the most involved, and I'd like to just recognize a little bit here, you might call me, Cindy Hubin, and Carrie with BITS, the project sponsors of this project, along with Alex and Skylar, both from ComDev and from BITS, the project managers, Brian Paul, our project rep lead and change manager, if you will, and then Bonnie and Jeremy have been our project management team, along with from Barry Dunn, we hired Fred Turnier, who has been helping us navigate the waters, and I can tell you it's been very valuable to have his interaction along with our vendor, which is named Sages out of Atlanta, and how Fred's helped us every step of the way, been with us every week working through the details, and it's been great to have someone help a small organization or a small department like ours get through what otherwise might be complicated from interactions with a vending company, but it's gone very well. So with that, as we said, we're excited to announce that we're launching our PATS program, the Permit Application and Tracking System. And the digital submission and online tracking will be a streamlining of our permit process that allows applicants to be able to be in touch with their permit every step along the way. So if you're a contractor, you're able to get online at any time, see where your project is, who's been reviewing it, and what comments there are as it moves along. So we think that that'll be much more efficient for someone who wants to check in on their project at any time. And it will improve Dev's efficiency. Some of the larger projects, we're not going to promise that the more complicated things will get through the process any more quickly, but I think everything will be a lot more available for people to share notes and progress reports throughout the project. So with that, I'm going to turn it over to Alex, and he can give you, or maybe Brian, they can give you where we are today and what it took to get here.
Brian, you're muted.
Sorry. There you go. So I'm going to give you some of the history and the background, of course, because I was around back then, and as Alex so bluntly put, I guess admittedly I'm old. I'll be 56 next month, so that's very exciting. So in 2012, the directive to move paperless was given to all county departments. Community development set out to identify several areas that we could make a change, and the largest effort would be in turning our whole permitting and application process into a digital format. We had to scan all of our existing folders and files and all of our paper documents and get all those into a digital process so that that history was available to us, and also moving forward, all that information could continue in a digital format. And then having a digital plan review process was the third thing that we identified that we could move into. And if Alex would go to the next slide, there's some slides of what our office previously looked like with all the paper files that we had on every wall that you turned. So I think there's like 4 sets of these, yeah. And if you see down that corridor where Tony's standing, you even see permits on the back corner wall there. And we had plans on every rack, on every wall, and we had 3 major size rolling plan bins and an entire cold storage building dedicated to paper plans because we were a paper office. And it was a pretty big effort to try to get all this converted to a digital format. So the next slide. From 2013 to 2015, we shopped with the city of Aspen to try to find a joint solution. And we tried to get something that would work for both of our permitting systems and both of our plan review processes. But through differing philosophies and differences of opinions, that kind of went a different direction. And so in that shopping process, we learned about a product called Bluebeam. And in 2015, 2016, we decided that we could at least start that component, the digital plan review component, and start doing plans through Bluebeam. So in September 2016, ComDev went live with a digital plan review process in what we call, which is the Bluebeam software that we use now, that's going to actually be integrated with our new Sages software. In 2018, ComDev scanned all of our paper documents. That included that warehouse full of rolled plans, all of the plans in our office, all of those paper files we showed you in those previous slides, and moved all that into a digital format. Next slide. Yeah. So here we are, moving over to the new building from City Hall, doing our Abbey Road version of walking only with our laptops in hand and no paper coming with us. So as you can see in our new office, there is no walls dedicated to paper plans and paper files. I shared a couple of pictures here too. There's one picture of one job site that we had the paper plans out on their furniture and all of the inspection sheets lined out across their countertops through their entire kitchen. And now all that process is actually in a digital format. We still have to have them have a paper permit set of drawings on the plan site, but all of those inspection documents, the yellow pieces of paper, and all that background and supporting documents can all be in a digital format now. So we aren't producing all that paper through our office. And in the lower right corner was just the Bluebeam emblem signifying us going to Bluebeam. So because of the delays in our shopping for the software, we created our own digital intake and review process through the Bluebeam Pros process, but we also purchased digital monitors, large monitors, to actually do the plan review in a digital format. We created our intake room, which had 2 large monitors in there, and when we meet with the public, we actually meet with a digital version of their plans up on a screen, and there is no paper brought into our office at any time. It's all through a paperless process. So we've kind of, in 4 years, hit that 2012 mandate of getting the office paperless. We still have some processes in the planning side of things because of recorded documents and vellums and things like that still have to come in paper or in a hard copy, but in TDRs, it has to be a hard copy. But we've, as much as possible, converted everything to a digital format. And in 2019, whoops, could you go back?
Sorry about that.
No, no problem. We also created our own temporary iPad inspection process. So I worked with BITS department and Alex and our project management team, and we came up with a way that the inspectors in the field could actually load their inspections each day that came in over the phone lines onto their iPads, go out in the field and actually process an inspection on their iPads. And all this groundwork was to kind of get everybody kind of in that mode of working towards this one solution that did all these things. This is all being done through 6 to 7 different processes. We have smart sheets for tracking. We have our own created iPad solution for the iPad inspections. We have Bluebeam for the plan review. And we have all these fragmented pieces. So the goal of Sages is to put all that into one container and have all these things working with the public so they can come in through a public portal, submit their documents online directly to us. We can take them from there, route them to the review team, do that entire process, go out and do the inspections and complete the whole thing, the whole strategy. So the next set of pictures, do we have more pictures or are we done? I think that's it.
Yeah, no more pictures.
Yeah, we're going on. So that was the preparation and the groundwork. So in that, we also had a little bit of a learning curve. Our original RFP only brought us 1 bidder, and we just decided that we weren't going to just settle for that 1 bidder. So we turned down that first initial bid and then spent the next year refining our requirements and shopping again for the actual person that we wanted to work with. We ended up getting 4 viable responses, and we did demos with them, and we scrutinized them to the nth degree and came up with Sages as our final solution. So, and then Alex will continue on with the future.
Yeah, so we selected Sages and had a project kickoff back in August of 2019. And then just looking from where we started to where we're at now, that was a 10-month project timeline that we've been on, which actually is a pretty aggressive timeline considering every component that this software project involves. The initial months we started with the configuration, migrating existing data from our Eden or Access database into Sages, making sure that we weren't going to lose any of that current information. Then we also had to train staff. We did that kind of at the beginning of this year, and we're currently working through user acceptance testing. This is a very fluid project. We've been working very well with our vendor. Our consultant, Barry Dunn, has been assisting us too for anything that we may overlook. We're looking to go live here in May, and we're very excited that this will meet the needs. Everybody on the project team has been working very hard over this past 10 months and even beforehand in order to get us to this point. So we're very excited for the public and for just the staff too. Now, kind of looking forward and where we're at. So this new process that everybody mentioned, PATS, that will be powered through Sages Gov, will allow for a digital web-based process as far as submitting, tracking, responding to any comments, paying fees online, requesting inspections, and even being able to archive these projects all in one place. And kind of as Brian alluded to, this is currently done through a lot of different systems and softwares, and so it's very difficult for staff to be able to do their job in an efficient manner and make sure that everything's accounted for. We hope that this will help address a lot of their needs and just make the whole process overall kind of speed through a lot more smoothly. Now, I'm sure for the public, and this is one of the reasons we wanted to present to the BOCC, was to update the public as well. Some may have noticed a press release that went out about a month ago we are preparing training and workshops that we'll meet with public on, so we can walk through how to use the system and help train them. Once they've accomplished that, we also have one-on-one meetings with staff where they can set aside some time to actually walk through submitting an application in SAGES. A more detailed schedule will be coming onto our website, where we will also have the ability for the public to sign up. All of the training sessions will be recorded and posted online, so that way anybody who can't attend any of the sessions that we may have can view them whenever best suits them. The next slide here, I'll just highlight the email address that's listed at the bottom there. So pats-support@pitkincounty.com. So if any members of the public, if anybody viewing this has any questions or would like additional information, please feel free to email that email address there. We have a group here of our team that will be responding to those emails and trying to keep the public as involved and up to date as possible. We currently are working on developing that web page that will be on our existing website, but the link that's listed at the top there, Pitkin County-Community Development, that page will take you to our existing web page. That is where the PATS website will be posted to once we get that up and running. A lot of different things going on in the air, so we're unable to get that established at the moment, but we are working behind the scenes. So with that, I'll open it up for questions from the commissioners.
All right, I'll look at the commissioners at home. Any comments or questions for the team? Greg, go ahead.
Just wanted to, I assume that the construction, the application making community is aware of this, and you've reached out to them through email or some sort of network, so they're aware that they can start learning about this and using it.
Correct. We did have a press release in both the newspapers about a month ago, and we are reaching out now to all licensed contractors and individuals who would be using the system to notify them. We're kind of beginning our outreach campaign where we're really interacting with the end user being the public or the contractor community, planning community, also environmental health. So that's a pretty broad range of people who could potentially use this system.
Any other questions? Steve, go ahead.
Yeah, just to comment, the timing of bringing this out might be just about perfect, where people have to do social distancing, and if the public can access all these things on their computer or at their office or at home and not have to come into ComDev, that's really a good thing in this day and age. So I guess you don't totally have it rolled out yet, but you're getting there.
Brian, you look like you want to comment?
Yeah, I just wanted to say to Steve that we thought about that. We thought about, should we delay this rollout? And we really thought that this was a great opportunity to have this digital format and the ability to exercise this. We also feel like, because it's been such a developmental process of teaching them the incremental pieces of the digital format, we've really kind of modeled SAGES after so much of the groundwork that we did. So those foundational pieces have kind of trained the public and the applicants to kind of understand where we were heading with SAGES. So the integration of the digital inspections, the integration of the digital review, the integration of the digital pre-submittal meetings, all were great building blocks towards getting the community ready for this.
Great. Greg, go ahead.
Another one just regarding, I was thinking about special event permits. And is special event permitting going to require a similar sort of platform? Is this going to work for that, or is this specifically for building?
No. Yeah, that's a great point you bring up. So we can clearly make this aware to all members of the public. Planning, environmental health, building, and code enforcement are all 4 departments that are incorporated within this. So any building permit application, whether it be a sign, a fence, all of that will be handled there. On the planning side, we also have planning applications, special events, Board of Adjustment, and Redstone Historic District Committee applications. For environmental health, any of the current applications that they have, I'm not as familiar. Skylar could probably speak to those. And then for code enforcement, if you're submitting a complaint with anything going on in the county, all of those different applications or submissions will be handled within stages. And so special events will be one of those underneath that planning.
Brian, go ahead.
I was just going to add too, the nice thing about this system is it integrates directly with GIS. So when an applicant starts an application, they actually have live data about their property and even about special event properties when there's multiple properties impacted by a special event. All the parcels can be looked at in GIS. So the nice thing about this tool is its integration with these other systems as well.
That's great.
All right, Patty, anything?
No, I think it's great, and I can't wait to see what the industry says once it's out there and working.
Okay, if there's nothing else, thank you all so much for the hard work that you're doing from home and getting this going, and nice seeing you all.
Thank you.
Okay, board, I'm going to ask for a couple-minute break here, so maybe just a 7-minute break. We'll come back at 5 to 3 and tackle future agendas a little bit early. All right, Grassroots, we're going to take a break until 2:55. Thank you.
Good job,
I have to go to the
Kelly.
restroom so bad.
What?
I have to go to the restroom so bad.
That's why I had to
All
go.
these drinks, you know.
Sorry, Maddie.
You figured it out pretty quickly. It's a good time to remind you, you see these lights on the phone are green? We're muted on the software, not the hardware.
You're up.
Okay, welcome back, everyone. Tuesday, May 5th, the Board of County Commissioners work session. We are now going to start talking about our future agendas. So, John, I'll check in with you.
Okay. Sure. Can you hear me okay?
Yes.
Yeah, okay. So, few things for you. First, for next week, May 12th agenda, right now it looks pretty, it will look different than what's in your packet. So, we have a joint open space and trails exec already planned. We would like to do a short lunch break from 12 to 12:30, and then go back into executive session to discuss airport negotiations, and then wrap up the day with Phillips, and then another COVID-19 update. So that did not make it into your packet. So next week will look pretty different. But there's some important conversations that are timely there. Other things I had for future agendas is really getting direction, if the board is prepared, on citizen board appointments, so that Charlotte can prepare a resolution for those. You've had two interviews for the Open Space and Trails Board. Michael Kinsley reapplied. He interviewed on March 24th. John Wilkinson applied. He had interviewed on March 10th. Then we also had one applicant for the Weed Advisory Board, Karen Teague. And we'll probably move the rest of the citizen board renewals to May 19th. So I don't know if the board is in a position to give direction on any of those appointments.
Are we doing that now? Are we doing agendas? Well, because Charlotte had on the May 13th agenda.
Oh.
So that's why we're checking in on that.
I got lost on that.
Okay, let's check in on Weed Advisory Board. Do we want to appoint Karen Teague?
Yes.
I would like to. Okay, thumbs up from everyone. Open Space and Trails, you've heard we have two applicants. Let's check in. Are we ready to appoint on? Oh, it's on. Okay.
It's all ready.
Yeah. Let me know if you can't hear me. Are we ready to appoint on Open Space and Trails? John, do you know if that application is still open or has it closed?
It is closed.
It is closed. Okay, so let me check in with commissioners at home on who you would like to appoint. John Wilkinson or Michael Kinsley are our applicants. Go ahead, Steve.
I like them both. I wish we could have them both on the board. I would defer to keeping Michael on the board right now because I think he's been doing a good job. He thinks outside the box on some things. He's a little bit of a...
Did we lose you?
Kind of breaking up.
Looks like you just muted, Steve. Yeah, something muted you, unless you're done.
Steve, can you please repeat? We heard you say that you think he thinks outside the box, and then you got broken up.
So I would reappoint Michael Kinsley. I wish we could have both of them on there, but we can't. We have to pick one. Since Michael's on there, I would keep him.
Okay. Greg?
I think I agree with Steve. I think Michael's doing a good job. He certainly is engaged. I think he was appointed to fulfill the rest of another person's term from a retiree. Was it Tim McFlynn or somebody?
That was Tim.
So I'd like to see Michael at least complete the term. So I think that's where my vote would be. But I was also, I have to say, I was super impressed with John, and I hope he gets on the Open Space Board next time an opening comes up.
Okay, and George, do you want to weigh in?
Michael's term is up right now, Greg. That's why we interviewed John Wilkinson. So this will be a start of a new term, terms of 5 years. Yeah, it's a tough choice. I think I would probably stay with Michael. He's been there for 2 years, and it takes a while to sort of get a learning curve, and open space has some big issues coming up, possible acquisitions, and also we're going to have to struggle with some financial impacts as well. So it's probably good to have someone that's had at least a couple of years under his belt and understands some of the current issues and budget needs.
Okay, thanks. Patty?
Yeah, I've had concerns with Michael and some of his contacts outside of the Open Space and Trails Board. And I think at the very beginning when he stepped in to take over Tim's, some of his conduct at our meetings was not what I would call acceptable. When he used to take over running the meetings, much to the demise of the chairman, which was me. I think he's calmed down a little bit on that. But I think John, I was kind of leaning more towards John because I kind of liked his some of his position on recreation, since we do have a lot of issues with recreation coming up and have some fair input there. But I see we have 3 members supporting Michael, so I think that's the direction we're going to go.
All right, and I'll just weigh in. Yeah, both 2 great applicants, I think, that bring their own working knowledge and expertise of different open space programs. I support keeping Michael on for a longer term. I think that he just always provides valuable insight in our conversations and takes a real comprehensive look at the program. So that's where I'm at for right now. Okay, so you have your direction, John. We're going to appoint Karen to the Weed Board and Michael Kinsley for a renewal to the Open Space and Trails Board. And I just want to check in, did we already do our appointments for P&Z? Because I know we had discussed that as well.
I think we
So
did.
is that coming before us on the 13th too? Charlotte?
It is,
Okay.
and we had direction to reappoint Chelsea and Jeffrey,
Perfect.
unless you tell me differently.
No, I thought that's what our conversation was. So I just want to make sure that was,
Yep.
We'll see that on the 13th.
Yep.
Okay, any further future agenda that you have for us, John, that you want to discuss?
Nope.
Okay, I'll open it up to the board for input on future agendas.
I have one.
Seeing none. Okay, Steve?
I know that the airport decision is we're going to have a couple of executive session periods talking about it, but I know that we had talked about breaking down the final report from the ASC Vision Committee and looking at chunks of it, the different sections of it, and having discussions and presentations on that. And none of that has shown up at this point in time. We also had talked about having the public meeting as kind of the next step where people could be there in person and do their public comment on the Vision Committee recommendations. So I'm just curious, what is our strategy going forward on, and what steps are we going to do in what order?
Steve, I think we're going to need to get a little bit more space from the amount of time that's getting spent on the COVID response, probably, before we can bring that back in a really ordered way. And I think we'll probably need to, before we're going to be able to have the gathering size, because we had during some of our meetings with the airport advisory committees and public, we had well over 100 people oftentimes attending those, and I would expect that interest will remain high and that we will need to be able to accommodate a large group. So I don't see that physical kind of gathering probably happening probably not till August, September or such at the earliest. So we haven't laid that out. There was some additional information, I think, that we can be working on right now, and we'll be talking to you guys about that in an upcoming meeting.
Okay, anything else from George or Greg? No? Patty?
As far as the airport, I know that we don't know how time's going to play out on it, but it would be nice if we had some kind of conclusion before the election, because depending upon who gets reelected or gets elected, we're going to have to bring people up to speed, and that is not going to be an easy chore, because it's been a lot, and it's going to continue to be a lot between now and then. So just to keep that in mind, I don't know how that'll pan out, but if we have to think about that. But I do have a comment about the agenda on Tuesday. I know a bunch of stuff's been added as far as the airport, and so I'm really sorry to say this, but my husband has to go into the hospital on Tuesday. So I will try and participate as best I can, but his procedure is scheduled for 11 o'clock. So I don't know how that's going to pan out. We'll be at Valley View, so I'll try and call in for what I can from afar, but I hate to be missing the airport discussion. I didn't know we were bringing that forward, but I really couldn't base my decision to have his procedure next week because it's really out of our control. So I'm sorry, I may or may not be here for all or part of that. And that's really the only other thing I had, because everything else is still kind of in limbo when we look at future agendas.
Mm-hmm. Okay, if we don't have anything else, then let's go ahead and move to board open discussion. I know we have an item on here from Cindy. John, is there anything you want to touch base on before we bring Cindy on? You're on mute.
My mouse wasn't working. I couldn't get to my mute button. I do think that there's probably, we'd like some guidance from the board around the opening of Independence Pass. It is scheduled to open on May 21st, which would be ahead of, I think, any of the timelines that we've talked about for going to the next phase of reopening. We understand that Lake County has requested a delay in the opening until after Memorial Day, I believe, and wanted to get some feedback from the board, whether you'd be in the same profile. And of course, this has to do with just continuing to limit access and outside visitation. I would just note that the governor's order runs through the 26th, and so the non-essential kind of travel or recreational travel restrictions in the state public health order go through then, and so that might be a date to align to and see what the new statewide public health order looks like.
John, what's the authority that we have on this decision?
To request CDOT. It's really a request, but I think CDOT right now is looking for input from local communities on this, given the exceptional circumstances. So you don't have the authority to close it, but I suspect if both Lake County and Picking County request it, that will happen.
Okay. George, go ahead. You're muted.
probably this is first sort of tongue in cheek. We couldn't just open up our side, could we, John?
That's what I was going to ask.
We're probably not, but I would be concerned about opening it up early.
Get out of town. We just
But that's another gateway and a relief valve from people on a front range who want to get up into the mountains. And I know what Memorial Day is always like up by Upper Lost Man, because everybody wants to ski up on Blue and Geisler, myself included. And there's people that come from both sides of the pass, and that would be really hard to control for social distancing, because there are cars parked all over the place, up and down, for those once that pass opens, and a lot of pent up demand to continue to uphill ski. Highlands probably won't have too many more days left in terms of being able to uphill there. Tayak's done, and so the next opportunity is to get up on the pass. So I think it's open. It'd be open for bicyclists. Probably is now, but once you start car traffic up there, you get into not only skiers, but you get snowmobilers and the whole gamut there. So I would delay and try to get some input from the Board of Health as well. And just as an aside, maybe for another part of the open discussion, would be a discussion about opening up Maroon, up the road up to Maroon Dells, which is another even more delicate issue. This relates to RAFTA and buses going up and down there.
Okay, Greg, go ahead.
Yeah, I was gonna say the same thing George did initially. I know a lot of people in the community actually suggested, wouldn't it be great if we could open up the pass so people could access some of the upper areas for alpine touring and things like that, without the pass being open. So if Lake County kept their side closed and we opened ours, that was an intriguing thought. But I also take George's point. I think I'd love to take this back to the Board of Health. If we're only going to be making a suggestion to the CDOT, why don't we can put that off and have a chat with the Board of Health on the topic.
And just to be clear for everyone, Brian Pettit just texted me, and it looks like CDOT and Lake County are looking at a June 1st opening right now.
Steve, go ahead.
Okay, so it's not an issue for me then.
Yeah.
Okay.
It's already been decided.
I was going to suggest that the Board of Health have a discussion on it. As an alternative, maybe the county could promote some uphilling in the Montezuma Basin area, or some other alternative that people could get to without having to pass. And I mean, I've never skied up there, but I know some people do. George is shaking his head. Have you skied up there, George?
Oh, it's good, but you got issues with the road getting up there, so that's a whole nother issue in terms of trying to utilize road and bridge staff to open up that road when there's so much else going on.
Patty?
See, they've already made the decision, so thank you, Lake County and CDOT, for making the decision.
But I don't know that they've made it. That's that's kind of where they're looking right now, and that would line up with.
Yeah, I thought you said that they'd made the decision of June 1st.
I think the recommendation, maybe.
Yeah.
Steve, go ahead. Sorry if I cut you off.
Yeah, the more we align the opening of the pass when we have restaurant and maybe closer to having some lodging facilities open would be more appropriate, because there will be people coming through, tourists coming down on our back road. If we don't have any facilities for them, that could create problems. So the closer we have Independence Pass to the other things, it'll just be easier to manage.
Okay, yeah, I agree with Steve. I'm as opposed to these one-off decisions, I really am trying to look at this as how do we expand our spheres of population and activity. And so to me, aligning that road opening should align with our other openings of welcoming people in from the outside. So that's my point of view on that. Anything else for open discussion, John?
Well, you all received a text from me just to make you aware that we do have a fire in the Crystal Valley. It is held pretty steady at around 10 acres. We expect to get mapping on it later on today. I know they had a helicopter as well as a fire crew working on it. It is on national forest land. There is some private land in close proximity. So we've already been in touch through emergency management on cost sharing and that sort of thing. We'll keep an eye on it. Unfortunately, it does appear that despite the fire restrictions, it was a campfire. So again, really encourage people to honor the fire restrictions, and we're stretched pretty thin managing one incident versus multiple incidents. So we'll keep you posted. It sounded like they were getting it contained, but we'll know more information later on.
Can you repeat the location again?
I don't have the mapping yet. I understand it's about 4 miles out of Redstone, I believe. I think it was north of Redstone.
Okay.
So.
Okay. Let's turn to Cindy and invite her on, and then we'll check in again with the board if board you have additional open discussion after Cindy's presentation. Cindy, you with us? Thanks. Hi.
Hi, everybody. Leslie Lamont jumped in and asked me if she could jump in right away and tell you something about her site visit.
Hi, thank you, Cindy.
That's mine. Sorry.
That's okay. The board has an item on your agenda. It is amendments to the Capitol Creek Ranch, and the applicant is setting up story polls Monday the 11th, and flagging. So the story polls will be for the new proposed home, and the flags will be for the proposed agricultural structures. Those should be up by Monday, but I will have a map and better logistics for you that I will send to you before Monday, hopefully, so you guys could do a individual drive-by. You can stay on Capitol Creek Road. You'll be able to see all the flags and the poles from Capitol Creek Road to facilitate your review for Wednesday's item.
Okay. All right, we'll look for that. Oh, George, go ahead. You're on mute. And
well, Leslie, can we have a drone as well, a video drone? Is that possible?
Well, I thought about that, but when we did the drone for you all for the solar project, Andrew Schumacher was behind that, and as you know, things are really, really tied up. And to prepare that drone presentation for you was took a lot of time.
Okay.
This is a request that the Snowmass Capitol Creek Caucus made, and I think the applicant was kind of reluctant to do this, and so I, after getting the referral comments from the caucus, pushed them hard to do this. So hopefully they'll get up by Monday.
Crystal.
Oh, thanks.
I thought she said Capitol. Which creek did she say? I thought
Capitol.
It's Capitol Creek. Oh, I thought you said Castle Creek.
Snowmass Capitol Creek Caucus, and the property is on Capitol Creek past the
I won't
monument.
be able to get up there. I'll take between.
It will be, I'm really sorry for the short notice on this, but it would be important if you could make it up there.
Thanks,
I'll ride
Leslie.
my
I'll
bike
use
with you,
it as an
Patty.
excuse to ride
Now,
my
is
bike.
it defined as an essential trip out of my home, or do I have to swing by the grocery store to make it essential?
This
you
is
go on
essential
Sunday,
for
you'll
your
be
job.
Yeah.
Okay. Let's move on. We have
I
a
go
few
on
minutes.
Sunday.
Okay. Thanks, Leslie. We'll look for that email with the information. Okay, Cindy, go ahead, please. You're on mute.
Too much going on.
Sorry, you're still on mute. Okay.
What is it, you
Go
guys,
ahead.
today?
Thank you. The board had asked for some research, a little bit of research on potential for baseline quality data while things were quiet. Things are not all that quiet anymore relative to cars, but I did do a little bit of research. We have tons of information available already for the PM 10, PM 2.5 measurements from the Yellow Brick, as well as some other air quality stations up at the top of Aspen Mountain. That being said, I did reach out to, I think some of the board members suggested that we talk to the Aspen Global Climate Institute. I had a great conversation with James and Elise from there. I think we're going to be connected on some assimilation of some existing data in a totally separate project, and that was great to engage them for some future input on climate action. But I was given a lead by Jeanette Whitcomb in the City of Aspen Environmental Health for air resource specialists out of Fort Collins. It turns out that air resource specialists out of Fort Collins have an available methodology that's called a canister study. A second ago, you saw a tripod jump up on the screen. I don't know if Alex is still there to help me with that. There it is, a picture of these tripods that are set up. There's 6 tripods set up at any given time. They have canisters on the top. They can be set in different locations, and they measure organic compounds. And there's 64 different types of measurements that can be taken. According to James with the Aspen Global Climate Institute, he sent me an article about some measurements that we might be interested in. And that has to do with more specifics I'll get into in a second. But basically this setup that we could use, we may want to look at, if you're interested, in 2 different times. One time period where these 6 different tripods with canisters would be set up for a week and take measurements, and then come back again after things are in full force. So say when retail's open, when the airport's open, when things are going full force, and I can't tell you when that's going to be, but sometime, I don't know, August, it doesn't sound like 4th of July, but whatever might be a good time. And then we would be able to compare those 2 different measurement times, and that's what it's worth. I mean, it's a snapshot in time, 2 separate times that might be helpful. But this technology is really good for us to know about for different studies throughout time. And I also think that we may want to collaborate further with Garfield County, who actually uses air resource specialists out of Fort Collins as well. And they have a mobile air quality station that's not so mobile anymore. They've set it up pretty permanently in Parachute that measures a bunch of different air quality factors. So I've learned a lot for you. I'm happy to answer questions. I think the best lead, I also talked with Tom Dunlop because he's on contract right now with public health, and the public health guys who know all of this. I'm just an interloper trying to help out. they, Tom Dunlop did tell me that they have history out of tons of information since the 80s that we might want to look at in comparisons. And then don't forget, we have some traffic count studies across Castle Creek Bridge. We also have some now along Brush Creek, and we can do some extrapolations with the traffic counts and what we decide to do if, in fact, you decide to go forward. And the only other piece of information, without getting into too much detail right now, is that those two different times of study for the 6 canisters each time would cost somewhere between $18,000 and $19,000. That includes setting up the canisters, taking them down, having those sent to the lab, and being analyzed.
Okay, questions for Cindy? Greg?
Yeah, hi, Cindy. Thank you for doing this. I've learned a little bit about these canisters, which basically are a vacuum, and they turn on and they suck in some of the atmosphere at a certain time and collect that sample, which then they can go in and take various tests on the air that's captured in that sample. I've also heard about the systems that are real time. There are sniffers that can do real time BOCC testing. And I think we did have a proposal in front of us at one point for real time monitoring that isn't as precise or doesn't get as many as 64 tests in one go. But I know there's some VOC measurement tools out there that are like a real time thing you could check in with almost daily. Those would need to be checked for precision and for utility and all that. But a proposal did come to us, which I forwarded to staff on that system. And it'd be worth just putting that into the hopper so people can get a look at it. So when people ask us about it, we'll say we looked at it.
Cindy, go ahead.
Just in response to that, I probably know enough to be dangerous here, but there's so many factors in this one study that James Arnott from Aspen Global Climate Institute sent me and could barely understand, but there's so many, the wind velocity, the time of year, all the meteorological factors that go into those kinds of studies, Greg, that my understanding is that it might be a little more reliable to have, these snapshots versus that. That's just what I've been able to glean.
Got it. Okay. Thank you.
Steve or George? No thoughts? Steve, go ahead.
Yeah, I would love to be able to get this baseline data recorded, especially when the airport is running at a low level, just a few flights a day, I think would be really, really valuable, and then be able to compare it when the airport is back in full operation. This is our one opportunity to do this study while there's very little air traffic, and to do the study in the vicinity of the airport and maybe as far down as Aspen Village, the Airport Business Center, and maybe up by Cemetery Lane would be 3 good locations where people have complained of odors from the airport and, at various times. So I don't know how we would pay for this at this time because our budget is crunched right now, but maybe we could get some private donations to help pay for it. I think it would be a valuable study.
Okay, check in with Patty.
Yeah, my question is, what are we doing with this information? If it's about the airport and the issues that have come up at the airport, I think a baseline, as Kelly has suggested, but I don't think we need to do it when we're open again. I think we need to, Cindy, it's not really associated with the COVID shutdowns other than the fact that the airport's so quiet. So I think doing it maybe once now, but also funding I'm looking at John Peacock, might be able to come out of the airport budget because I don't think we have the money on any other aspects right now, even for $20,000 right now. We have to be very careful with all of our pennies. So if we can find a way to maybe fund it through the airport and use it as far as our airport new plans that are coming forward, that might be more appropriate.
So can I jump in? I'll jump in with some comments. You know, thanks for your support for consideration of this idea that I brought forward. You know, Steve said it best. This is the opportunity to do it and get a baseline. I don't think it begs a permanent, robust air quality program. So I'm not making the assumption that doing this leads to that. I think that doing this gives us valuable information that is kind of once in a lifetime about our community impacts and can let us decide when in the future we want to use that information to test it against. So that's sort of my interest in collecting this now. And, you know, if there's support, I'd like to ask John if staff can look into seeing if there is budget available from somewhere to do this, because, you know, we're not talking about a comprehensive sort of county-wide air quality sample. I think looking at around the airport makes the most sense because it's ostensibly the probably dirtiest place in the county. And that, based on my conversation prior to, you know, other conversations with Cindy about our climate change stuff, we have good climate change modeling, but we don't necessarily have good air quality information at our hand. So I've heard Patty's support trying to find money
Through the airport would make sense to me.
I see Steve shaking his head if that's an okay next step for staff. But again, we do want to try and get this done quickly. So Cindy, is this something that the Fort Collins, you know, group could send to us? Do we have capacity? Do you have capacity to help set this up? What would you need in addition to just the budget?
Yeah, when I thought it might be a little more robust and many different change outs of the canisters, you know, I thought about that and thought, could we be trained to do that and save money? But this proposal is only for, you know, 2 times to set this up. The cost I quoted you includes the air resource specialists coming and doing that themselves. Just another question I would throw out there is, you know, what we're really wanting to get out of this. My assumption in looking at this is it's for human health attributes more than anything. And some of the studies that we're finding around airports elsewhere, be they larger airports, but the largest contributor to health issues is really PM 2.5 is what's coming out of the studies. So I want to make sure before we jump into anything that, you know, we're getting the information, data that you want. And my assumption is it's about health around the airport.
Yeah, Patty, go ahead.
I don't think it's PM 2.5 because I think we're worried more about volatiles than we are about particulate. Because for me, that's the bigger health risk at that stretch of the highway is not so much the dust, it's what's in the air as far as volatiles, like the fumes and the stuff coming off either highway traffic or airport traffic. And I think that would be the time now for us to test that, because this is a dusty time of year anyway with the wind blowing and dust everywhere. So I don't think we get a good baseline for that. And I think we'd only need a one-time testing to get a baseline, get that baseline, and then in the future when things are literally not because of COVID, well, kind of, but when the airport's back up again, we can then figure it out, because I think the concern for public health is what are the impacts coming from in that stretch of the highway because of the airport would be why I'm supporting it. PM 2.5 is just about anything. PM 2.5 is such a minute particulate that you have it, it's pollen. It's not necessarily dust part, you know, like from road sanding like PM10 is.
And for the board, I think you need to understand all of these are going to be difficult to speciate to a specific source. VOCs come from multiple sources, as well as 2.5 and such. And so the recommendations of the Vision Committee were really twofold, to get some baseline studies generally, understanding that it would be difficult to speciate the source, and then to also do modeling with that, which may give us a better sense of what is produced at the airport versus other sources. And so this will not necessarily give you that information relative to the airport. What it will tell you, what it will measure, is the air quality for that stretch, and it does give us some baseline. So I just want to be clear, you're not necessarily speciating VOCs and that sort of thing to a source with this study.
George, it looked like you wanted to jump in.
Well, no, I agree with John. It's always been the question. I mean, part of this is being driven by the potential airport expansion, but there's always been the question in terms of specificity and accuracy as relates to the what's always been a slow-moving parking lot out there as well. And so it'd be interesting to know if they can actually segregate in their studies what's going on at the runway versus Highway 82, because if you can't, I'm not sure what that's really going to be telling us, except for an overall baseline, but not being able to isolate the airport from 82.
Cindy, go ahead.
Yeah, the only difference is that with no activity at the airport in one of the measurements, and then with full-on activity again at another time at the airport, theoretically you could talk about the difference.
So I'm sorry. So you would be able to set this up, these devices up over on the runway or by the runway, far enough away from Highway 82 that it would not be picking up dust or anything else from 82. Because right now we're seeing. I was out into Basalt today, and there was just a stream of trucks going up 82.
I think it's really difficult to speciate, but the baseline data in terms of what the health impacts are of air quality, regardless of the source, I think is useful information, and if there are health impacts there. And then you can start to do problem solving from there to the degree that you can.
And I would note, Cindy, in our prior conversation, that these can be timed. So, they could be timed for 2 a.m. on a Sunday when there's no planes and there's very little traffic on Highway 82. And I don't, again, there's a lot of assumptions being made there about how long it takes for those things to move out of the air and blah, 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 blah. But, having this information is better than not having this information, and this is our opportunity to get the best baseline. Greg, go ahead.
Yeah, I just wanted to say, I think, there's the argument that the information might not be as good as we'd like, or it might be hard to tell one thing or other. It doesn't hold water for me. I think Cindy made a good point there. I think more information is better, but what we do need is help from someone like Aspen Global Change or an expert who can really go through and help design the test properly in the right locations and understand the equipment, what it's capable of doing. I do understand that the canister tests really are the top of the line, but they are one slice in time, right? It sucks all the air in at one point, and then that's one of the 6 cans is done. And so clearly they know how to design these things. The real-time monitoring system that I mentioned, I learned just enough to get myself in trouble on, is that they do measure volatile organic chemicals, but they can't distinguish between, say, a skunk and a jet taking off. So they have to be designed and located in places. They can tell if there's a plume, for instance, from prevailing wind direction. So I think that depending on where we put them and how they're set up, and if we have, global change or somebody helping do it, perhaps there is some valuable data to be collected. So I would say it doesn't seem like the ask is too great. This is an opportunity that I'm in favor of pursuing, and I really would like us to look at this other option. And I've sent you all the letters that I received. It's been over a year that this has come to us, and honestly, the response has been crickets lately. So I would love to see it through and get a final answer on whether or not this is something we can do.
Patty has another comment.
For me, it comes down to where the funding is going to come from at a time where we're looking at where funding is coming from for a lot of things. And I am not interested in PM 2.5 because I've got a lot of history with PM 10, a lot of history with the compliance or lack of compliance with the city of Aspen. And there's just too many concerns about PM 2.5 and the data that you get from it. Volatile's a whole different story for me, especially along that stretch of highway.
Okay. John and Cindy, do you have direction? And I'm happy to be a point person too.
I'm not sure I heard total agreement or direction from the board, Kelly. I'm sorry. So is the direction to
I think the direction is to try and find out if we have funds to do this, because we'd like to do it quickly.
Okay.
And we need to do it quickly if we're going to do it at all.
Yeah. Yeah.
And also, I just want to make sure you circle back on what it is. So we really thoroughly examine the options and eliminate the ones that aren't going to work, and then we hear about why. Thanks.
So does that mean that the other information that I have not read, Greg, that you sent forward, you would like us to research that as well? I'm just a little afraid to lose any time if that's what we're trying to capture here.
Right. Okay. Well, if you could look at the email thread, and you weren't party to it, but other staff were. Phyllis, I think, I sent it most recently. John previously. There's actually a quote from a company called APIS. They have a pretty thorough description of what they do. They do have monitoring in the valley, in the community already. I think at the school, they're doing monitoring already. So it's somebody with a track record. It may be they're not the only ones who do this. So if it's a matter of getting a bid from someone, that's still possible. But I never really felt that we had a thorough examination of what they could offer us. And so I don't think it's going to take a lot of time, but I think it's a good opportunity to do it, and this would be a time to review that. That's what I'd like to see, and I'm happy to stand down if it just doesn't turn out to be the right company, but I want to make sure we looked at it, because people have been asking me. One in particular has been really on this, and it's been a year.
Can we just agree? So I think we need to give Cindy some parameters, and I would just offer that I think the parameters are, this will be a snapshot in time, and we want information on VOCs in and around the vicinity of the highway, near the airport. Is there any other thing that you?
Yeah, it needs to be set up by next Monday, because after the Board of Health opens everything on Friday, we're going to want to have that baseline.
So the timing is obviously paramount.
Yeah, good luck with that.
No problem, no problem. And we want to know where the funding definitely is coming from.
Yeah, I don't think Monday's possible. The people at the Air Resource Specialist said that they would need a week to get everything up here. And
we only need one test. We don't need two different.
Okay, so if we could get follow up on that for next work session. Is that clearer, John and Cindy? Okay. Thank you.
Thanks, Cindy.
Very much. Is there anything else from the board for open discussion?
I've got some.
Greg, go ahead.
We're probably going to hear this again, and we probably heard it already, but I'd love to hear more about the progress on the decommissioning or the transition of the IMT to the new acronym. Is it the JEC?
The JIC?
EOC.
Yeah, and also just the topic of the undercurrent is the re-engagement of the electeds in the decision making and information sharing process, or maybe it's the increased engagement of the electeds. So I think we all have a feeling that we're watching a process go on with this emergency response, and we're 2 months into the emergency now, and I don't want to beat a dead horse, but I'd love to hear just how that's going and what we can anticipate.
I think that's to you, John Peacock.
Yeah, so we're working through a transition now that, and it's really going from incident management team, Greg, to the emergency operations center. So in this case, there will be some changes in roles. Karen will remain in a role of an incident commander. Valerie is going to be more closely tied to helping in managing the EOC. We're going to be working more closely with the managers and hopefully getting information to the boards in a more structured way as we go through decision making. We've got paths as we've kind of discussed today. I think if we can get into that structure, then we can get into more of a rhythm of updating the board where we are in the criteria, the discussions that are happening with the industry groups on reopening, and get more feedback on a regular basis. That will help inform Board of Health decisions and such. We'll also be looking at trying to create a more regular meeting or opportunity for press interaction and such too. So we're working through that transition right now. It's really to get us into a more sustainable structure going forward.
George, go ahead.
As I mentioned earlier, John, I think we should have an update or discussion concerning the maroon bells. I know Brian has been meeting with the Forest Service and I think RAFTA, I don't know who else. I'm not seeing that it's going to be really feasible for RAFTA to be running buses up and down the road and keeping social distancing. It just doesn't make any sense at all, which means that unless we close that road, we're going to see an influx of cars going up and down that road. So I think that's a discussion we need to have fairly soon and with our partners. It is our road, and we can control that.
Yeah, and I know there have been some ongoing discussions between RAFTA and the Forest Service and Public Works, George, and I know right now there are no plans to open up the top until the end of May, but we can bring back a conversation on that.
Yeah, because end of May, I mean, again, if RAFTA's not running, the whole reason why RAFTA was implemented 30 years ago was to keep traffic from going up and down into that fragile environment. So if we're not running buses up there, which I just can't see we're going to do, why would we want to keep that road open? So that's a discussion we need to have sooner than later, and maybe it's just a topic for Board of Health as well.
Okay, Steve, I don't see you on my screen. Let me see. Did you have anything for open discussion, Steve? Yeah.
I do have, on the same topic, I would love to have the Board of Health take a more prominent role in the discussions. We do have 2 elected officials on there as well as health experts, and I don't think we've been hearing enough from them. I would like to hear more from them and have them be empowered a little bit more than they have been on these discussions.
I'm going to comment on that.
Go ahead, Patty.
Yeah, we're going to start having Board of Health meetings every Thursday. We're going to start bringing back a discussion for the BOCC every Tuesday to discuss what's going with the Board of Health. And I, for one, am concerned about the power the Board of Health already has without bringing in recommendations and opinions of the BOCC, since at the end of the day, we are really responsible for what's going on here. So I think the Board of Health has their authority, as does Karen, but that doesn't mean that the Board of County Commissioners shouldn't have the opportunity to weigh in. And I think we kind of have a plan set up for that with meetings scheduled every week until we decide we don't need them anymore. And in the meantime, we're going to book time so we have time on our agendas.
Okay.
So can
Any
I
other
move-
items for Board of Open Discussion? Let's get into exec, because I know we have a lot there too.
I'm going to make a motion to go into executive session for the purposes of, and I do not have a list.
See, let me.
And I would like to add one other item that will be very brief.
Sorry for the delay while I bring up our agenda.
Are we staying in this particular call, or do we have to hang up and dial in another?
We'll hang up and dial in another, and I can send you the link, Greg, if you don't have it.
I think I have that on my calendar, thanks.
Okay, so special meeting call for executive session for the purposes of discussion of personnel, Upper Midnight Mine litigation, Basalt Vista employee housing project, airline and FAA negotiations, employee housing fee, all pursuant to CRS 24-6-4024B.
And I just want to add to that a brief discussion. It's just related to the COVID-19. It's just a request for information about donations and how we would process them.
Okay. I don't know if that falls under.
Attorney-client privilege.
Okay. So Patty's made a motion to go into a special meeting.
Second?
Thank you, Greg. All in favor? Say
Aye.
Aye.
Okay, we need to move, I think, out of this room and.
All right, folks, let's give it 5 minutes and then connect on the other line for exec.
See you in 5. Remember to mute on your